Maybe I'll just give a brief intro. So we are super excited to have Wilder Foundation staff with us today. They have been a partner in looking at the social return on investment of our FRCs. And in addition, just as a reminder, Wilder Foundation is also the Family Resource Center Network home. And so they will really be this bridge or umbrella where all family resource centers across the state will feed into the Wilder Foundation, both in terms of data, program evaluation, training, technical assistance. So we're happy to have them here. They are going to walk through, obviously, the return on investment study that's been completed. And then Nikki and I may butt in here and there to offer some Scott County specific information. But with that, I'll turn it over to my colleagues to introduce themselves.
Great. Hi, everybody. We're so happy to be here. We've been working very closely with Suzanne and Nikki for several months to bring this to you. I'm Kristen Dillon, and I'm the Associate Director of Research at Wilder Research. I've been with our organization for about 18 years, and my role on this project is just kind of translating some of the really technical, complex analysis for those of us that are not economists. And my colleague Justin here.
My name is Justin Hollis. I'm a research economist with Wilder Research. I've been with the organization for about 8 years, and I've made everyone's job hard here.
Hello everyone, I'm Craig Sweet, and I'm the network manager. So as Suzanne was talking about, is that the fact that the statewide network is now housed at Wilder, and so is my role to try to connect FRCs across the state. And I was just here as background and just other sorts of things. So I'm not an economist or the researcher. I'm there doing the programmatic and making those linkages. So I'm here to give some statewide context if desired.
Great, well thank you for being here. And just from a scheduling, I think we've got about 30 minutes planned to include some Q&A. So with that, I'll let you all take it away.
Great, thank you. So just in case you haven't heard of us before, I'm just going to take a moment to introduce Wilder Research, our organization. So we're part of a larger nonprofit organization in St. Paul called the Wilder Foundation. So our organization provides direct service, and we are part of the research arm. So we do research and evaluation at a local and national level. Our overall organization is intended to be here into perpetuity to serve Minnesotans. And our vision is that we try to help people thrive in their fullness. We are really aimed at trying to improve the community, make lives better. And part of being a nonprofit research and evaluation group is that we center community in all of the work that we do. And that's a really important part of our work. And then I'm going to hand it over to Nikki to talk about the Family Resource Center.
So what is a Family Resource Center? This study is really based on our Scott County Family Resource Center, and it's, like all of you know, the universal access point for education, support services, and building community. Safe, accessible places for families to connect with support services and each other. Programs tailored to meet the needs of the community, and our core services focus on parenting, education, skills, early childhood literacy, and making sure that people have basic needs. And a place where individuals and organizations come together to help families thrive. We have at our Family Resource Center really tried to take a look at what services and supports are needed for families that also enter our child protection system, and working closely with child protection to make sure we're making that connection. So again, like we talked over the years, to support families be strong, healthy, and successful, to contribute to building a strong and healthy community, and how do we help people connect with each other, especially families that sometimes appear to be more isolated, and then how do we reduce the likelihood of child abuse and neglect by increasing families, strengthening families' protective factors, and then again also working with our child protection team about what services and supports families are in need of, and how we can make sure families access those early on.
And I know as we get further into the discussion, Justin will speak to it, but again, as just a reminder, this return on investment was really narrowly focused based on certainly our emphasis here in Scott County, which has been how are we doing in terms of reducing child abuse and neglect. Other studies, again, Justin may reference this, other ROI studies on family resource centers across the country have a much broader look at outcomes or impacts. And so again, based on 15, 20 years of history. For this purpose, we're really looking at the Scott County work over the last 4 years.
Suzanne, just one question there. Thank you for emphasizing that, because in reviewing this study, that was obvious, and that's important and where we should start. But I think I'd love to hear at the end your thoughts, you and Nikki's thoughts, and maybe our friends from Wilder's thoughts. There's good ROI on that. What are the next things we should be looking at? Because we know that our family resource centers are making differences in other areas, and I think that helps. So I would love to end with that. Thank you.
Double down.
I think Justin will probably be able to speak to that. And I think that's part of this conversation. What are the other key outcomes that we want to prioritize? And so then as we look at the future of FRCs, what do we have to do around data collection to position us sort of for the next evolution?
So I think as Suzanne and Nikki were saying, what our goal was for this ROI in that narrow focus was to understand whether savings from avoided child protection system involvement offsets the investments for FRCs. So we know that these are not the only outcomes that the FRCs are achieving in Scott County. We know that there are other impacts on families' lives, but this is the area that we were able to look at because first of all, we have the most robust outcome data available around these outcomes. And second of all, we know that a lot of the work in the FRCs, in Scott County in particular, started from this child protection lens. And so we know that there was already some initial evidence pointing towards reductions in child protection involvement. And so it seemed like a really important area for us to start with.
And can I was remiss, I want to do one call out to just recognize. So this work really wouldn't have been possible if not for the support of Casey Family Programs. They've been a long-standing partner to our work, and they, through their support, really helped to fund this evaluation. And so I just want the board to be aware of our long-standing partnership and support with Casey Family Programs.
Thank you. Yes, we're grateful. So I think this is just a little bit of a step towards the question around what additional outcomes could we or should we look at in the future. So when we're thinking about the impacts of the FRCs in Scott County on families, some of the areas that we believe, either based on our theory of change or there's been prior evidence to support, that there are impacts from the FRCs in terms of meeting families' basic needs and increasing their access to things like food, clothing, school supplies, things that they need to live. We know that there is some initial evidence related to improved access to reliable, safe, and affordable childcare, which can also impact a family's ability to remain or rejoin the workforce. We have seen some initial evidence around improved school readiness and attendance, and I know there are other efforts in Scott County around school readiness and attendance, and so putting all of that together into a holistic picture could be really illuminating. We have evidence to support that FRCs in general tend to have an impact on increased access to housing supports, and we know that there's often a large return on investment for securing reliable and stable housing, and that's also a driver of employment participation. And then part of the goals of the FRCs is to increase parental resilience and support, and certainly that does show up in the child protection space, but it shows up in other places too, such as supporting education, supporting youth access to opportunities, and so that's not, the outcomes we're looking at today are not the only outcomes that we would anticipate coming from those shorter term outcomes. So in the future, we believe that there is a really strong motivator to potentially try to unpack some of the economic stability that could be a result of the work of the FRCs, particularly as the FRCs are in place over a longer period of time and there's more time for those shorter term outcomes to manifest in those longer term outcomes. We believe that those shorter term outcomes will likely have an impact on increased earnings and tax contributions through that employment engagement and decreased homelessness. And we know from past return on investment studies that those can be large areas of return, economic return. And so as you continue to do this work, those might be some places to look.
Suzanne, I just wanted to add, I think, like we heard the auditor today talk about why the board was investing. And if I go back to their strategic plan, right, the whole thing about the FRC was the stability of kids, it encompasses all of that in that one statement. I think that's an important part of that discussion when you look at Scott County and why they made that investment.
Yeah. And I think the thing to also remember is this idea of, like, the FRCs are part of this web of prevention services. So like the school attendance, right, we've looked at it sort of as a separate entity or program or initiative, but they work out of the FRC. And so there's this integration. So as we focus here today on the Family Resource Center, it's much broader in terms of, I think, the potential reach. The work we've done around housing, all of that gets intertwined in our upstream efforts.
Yeah, and this aligns perfectly with, sort of what our premise is for the research, and in terms of, how we're thinking about FRCs. So this idea that strengthening, stabilizing families upstream reduces their involvement in the child protection system downstream. And so with that, our research question, again, really narrowly focused, was, are savings from avoided child protection system involvement sufficient to offset investments in FRCs? We're not looking at any of the other value that FRCs create. We're only looking at avoided child protection involvement. So we took a layered approach, and each of these sort of analytical approaches supports one another, but is also kind of independently corroborating our results. So our pre-post analysis was a very simple before and after question. That is, if we're looking at avoided child protection involvement, is there any evidence to say that child protection assessments went down after FRCs came into being? The second question is a related question, but a slightly different question, which is basically, does more engagement with FRCs create more intense reductions in child protection assessments? The third layer addresses that question, but from a different perspective, and it's really about, will families who are in greater need be driving any of the results in terms of reductions in child protection assessments, and how do we account for differences in families? The fourth question, cohort replication, is this something that we're seeing over all of the study years that we have data available for? Is it kind of consistent across years? And then sensitivity analysis, how much do these results depend on what we assume about FRCs? So with that, just kind of an overview of Scott County's population. So, I mean, in addition to being an economist, I'm also a demographer and a data scientist. So the numbers on the right are, sort of round numbers of Scott County's individual population, their total household population, and then of particular interest to us, households with children under 18. The data that we had available to us included 1,096 households with children that are sort of child protection eligible, so to speak. That's about 5% of all households with children in Scott County. So just to sort of get a sense of, how much of Scott County's families have FRCs seen over the course of this study, about 5% of them. So we really do owe a huge gratitude to the Department of Health and Human Services for supplying us with this linked data. So I think, one of the linchpins, one of the most unique parts of this study is how we were able to take Family Resource Center household data, and they were able to link it with SSIS data from the state, so that we have a set of households that are present in both program rosters from FRCs and child protection records. So,
And can I just do a call
Yeah.
out just to recognize, like, because we have antiquated systems, there was no automation to this. We were fortunate, many of you will remember Chris Harder. We brought her back and she really took any person in our Salesforce database and did a manual comparison to who exists in our SSIS system. So one, we owe her certainly a great thanks, and perhaps we'll share some stories from her perspective along the way, but if we had better technology, it might have made the comparison a little easier.
Well, and I was gonna ask, like, this is the first, I figured it was that. This is the first time in 10 years that SSIS had a positive nod, but the reality was a nod to Chris Harder.
Correct.
Yeah.
This
I'm
is
like,
not
no,
SSIS.
this can't be happening. There's no way with Salesforce? No way. No way.
It's your returnship vision.
Well, yeah, but we might have just ruined that with her. She's not coming back. She might think we're doing an SIS all the time with her.
well, she was very, very gracious in her time and really provided a lot of critical insight at the outset when I'm trying to sort of digest the data and understand, you know, of this, what's going to make the most compelling analytical data set. So even with all of that hard work, we've got, you know, 1,752 records. Some additional cleaning needed to be done, which I think, again, tends toward under evaluating our results. It makes our results more conservative. So after all of the cleaning, removal of duplicates and funny date formats and all the kinds of things that data can have associated with it, this is sort of who walked in FRC doors over the course of the study period. So we had, you know, about 4.5 years of data, again, linked with SSIS records. And these are sort of the households served each year by FRCs across all of their sites.
Suzanne, what does it say to you when it's down in 25? Is that we've reached families who then we've made an impact on, so less people actually, I'm just curious what that tells you. I don't know.
It's my understanding with the data too, that when we tracked it, we tracked when the family's first contact with an FRC was. So it could be that, you know, in 300 families, but like in 219, we could still have had 300, but 100 of them had already visited.
So they were already, but new contacts, we
Yes.
see it coming down a little bit,
Correct, yeah.
which means the word might be getting,
Correct.
okay.
And we'll see a little bit more about that. So this is kind of a look at the tenure of households that interact with FRCs, families, and these are, each of these is a complete count, right? And so the 3-year doesn't include the 2-year, and the 4-year doesn't include, so, you know, this is a look at kind of longevity in terms of engagement over time with numbers of families, and again, some of the phenomena that you point to. We can also see that, you know, families obviously who had their first contact much later had far fewer follow-up years in order to sort of continue that engagement. And so we've got a little bit of a spread of families who've been engaging with FRCs since the outset, and then families who sort of just became aware of and just started engaging with FRCs kind of at the end of the time period that we have data for.
Is it fair to say that this like
Yeah.
kind of shows us a little bit less that people need us every year?
In part, if we're looking at the end, the number of families with first contact over time, you know, does seem to kind of be diminishing, but again, the families at the end have had less time to to sort of to follow up and continue. So, I mean, it's 4 years, it's 4 data points. I don't know if I would call it a trend. I would maybe cautiously look at it as a stepwise decline, but yeah.
Yeah, and I guess what comes to mind for me, maybe that's true, or is it that with this population of families, we've kind of reached the ones that are easiest to reach within the population, and we might need some additional inroads, connections to reach
Sure.
that next level. I see. I think you're right, like, who knows? This could be a couple
And some of the
months.
results and implications, I think, will speak further to some of, I think, what's being talked about here. Again, just a real quick look at multi-year versus single-year engagement. You can see that, you know, the overwhelming majority of families who are touched by FRCs are touched kind of within a single year. It's a smaller number of families who might have that multi-year engagement, and so, you know, again, just kind of a profile of who's being served by FRCs in turn, you know, kind of understanding how these results might be coming about. Let me also be clear about some of what's on the screen here. So we've got average number of contacts, average number of visits. We've got the average number of days that they engage. The average service type, so this is the average number of programs that they engage family resource centers with. CP prior is child protection assessment rates, so it's the percentage of families that had child protection assessments before they had a first contact with FRCs. And then CP post last is the percentage of families that had child protection records after their last contact with FRCs.
12 months after.
Yeah, 12 months.
Out of that family.
The prior isn't limited to 12 months, it's just prior, or it is?
No, we did look at 12 months
yeah.
prior to
Thank
intake, yeah.
So again, first contact over on the left, number of contacts. So again, 68% of families in this study over this 4 years only ever visited a family resource center once. And then you can, you know, kind of get a sense for what some of the other high-touch family scenarios look like. You know, again, the vast majority are single visits or two to three visits. And very, very few get to that 10 or above. Again, just another profile of who FRCs have served. So on the left, we've got number of children in households. So the big numbers there are households, numbers of households. So numbers of households with one child, 53%. Numbers of households with 2 children, numbers of households with 3 children. So that's sort of how that is read on the left. And then similarly on the right, you know, a really substantial number of single parent households with just one adult in the household. You know, far fewer 2 adult households. And then some other configurations, again, some households are going to be family households, other households are going to be collections of individuals who are not related by adoption, birth, or marriage. But as long as there was a person under 18 present, you know, we try to retain them in the analytical file.
Quick question,
Yes.
if I may. Maybe not quick, but that last slide,
Yes.
I feel like we all in this room, outside this room, know that to be an issue on the right, and yet so little seems to go into finding solutions or encouraging solutions to that issue. Beat around the bush and spend billions doing a whole lot of other things. There's your problem, in my humble opinion.
You're talking about single parent families.
Yep. Like, am I culturally unaware? Am I off the deep end? Or that just seems like not even an aha, like just like so obvious, and we just don't. And again, I'm including the we, like much bigger government-y, non-profit-y, like we're just beating around the bush and spending billions. Boom. There you go.
Yeah, this is
Remember,
just
remember, it
the
was a quick question.
demographic composition of families who have come into FRC doors in Scott County.
But a number like that, that's crazy. Like we're not jumping off the, like, holy cow. We want to
Well-
find a silver bullet, so to speak. I know there's not a silver bullet,
Yeah.
sort of there is,
I
but
think the Family Resource Center is a part of that, of looking at how do we then help build community. We're not, it's not a strategy around household composition. It is about how do we build community, because as we know, kids, when we can surround kids with a village, right, the outcomes and trajectory look better. So it is a different way to try to look at a strategy of how are we building supports around vulnerable families.
sure, I mean, I'm pro-village, I'll call it community, in my word. But these numbers say we should be, instead of pro-village, we should be pro-two parents in a family. These numbers, if we call ourselves data-driven and all those things, holy cow.
But those
Wow,
numbers are just who's visiting.
sure.
Right, it's not,
Sure.
they have to be representative of the community.
I think the whole, I guess if you're proposing laws that we
Not
have to
laws,
start
not
importing
laws.
other parents into households.
Not laws.
Yeah.
I can't
I don't
legislate some
think
of those
it's
things.
laws, are there things we could do to support that, right? And what do those look like? And that's a different question than what we're
Right.
looking at here. I mean, child support works on those types of things, right? Trying to reunite three people. So I mean, I think there's different things, Commissioner. You know, it does say the number of adults in household, not who visited. So that, to me, says they're single family, but that's a different discussion than what we're looking at here.
Sure it is, but I'm just like, with what comes across our tables and desks and phones and computers, oh, if we can move the needle 1% over in this, you rarely do you see a slide, because we don't look at it probably, again, the greater we, I'm pro Scott County, so all those things. But I'm just like, it's almost comical that this is like, okay, 86%, okay, next slide. Not you guys, just the generalization of what government tries to work on. And we have this, like in black and white, whatever that color is.
Well, I think that you're speaking of something that's maybe a few antecedents removed from this, which is, again, who comes in FRC's doors and what FRCs are about. They're about family stabilization. So they want to stabilize who comes in the door. They're not about family formation and telling folks sort of how their households and families ought to be composed. So this is, again, these are just sort of the facts of who has come in the doors looking for resources from family resource centers. And it stands to reason that maybe a high majority of them are single parents, looking for services and supports. I don't think there's anything surprising about
Yeah, and
that.
it's a bigger picture, of course,
Right.
but the irony is that there are many government programs that do just what you said, that suggest or strongly encourage, this is the way families should look. But yet then you have this and it's like, oh, no, we don't want to talk about how families should look. So just fun little ironies. Again, bigger than you guys, bigger than us, this is just a fun little exercise if we were to chase this down a little bit, which
To be clear, I make no claims about what families should or shouldn't.
Yeah. No, I'm not,
I'm
not
telling
suggesting
you
Wilder or
what they
you
in
or-
fact look like coming into FRC doors.
Yeah.
Again, another little tidbit about
Suzanne's
what,
getting nervous down there, sorry.
about the families that FRCs are serving. So the primary language spoken in their home. Again, which does not mean it's the only language or the exclusive language that they are able to speak. It's just, this is the language that they report that they are comfortable speaking in their homes. Okay, with that, let's get to the meat and potatoes, right? First of all, child protection involvement among FRC's families is rare. It's really, really uncommon. So only about 5% of that 1,096 families had any indication of child protection system involvement before making first contact. And so I think that speaks quite a bit to what what we were talking about here. It's some of the groundwork that was laid before family resource centers sort of officially coalesced appears to have been sort of effective. I mean, if the work is about prevention, then I think that a base rate of 5.1% of families coming into FRC doors with child protection incidents is pretty good. So I think it also suggests that the real value of FRC stabilization lies in some of these other domains that my colleague mentioned, like housing, food, employment, well-being. So child protection is, you know, by this indication, not the #1 reason that families come into FRCs.
And it may be a place, back to Commissioner Brekke, your piece around how are we reaching perhaps the most vulnerable? And I think there's certainly still opportunities for us to refine and scale out that reach differently.
Okay, I'll zip through the methodological layers and get the research questions answered, and then maybe we'll have time for discussion. So the first question, the pre-post analysis, before, after. Did child protection cases in fact decline after FRC contact for the families that had child protection? So around 5% had child protection before intake, and only 2% had child protection after. So this is a pretty unambiguous yes. Child protection involvement was cut in half before and after contact with FRCs. Fewer families had CP involvement in, you know, after FRC engagement compared to before. So, you know, a drop from 56 to 25. Does more engagement produce better outcomes? So this is that dose response question. Again, a reminder, 68% of the families in our study only ever had a single visit with FRCs. And so we're sort of left with that other third to look to see whether or not increased engagement, and I mean that in a couple of ways, increased numbers of contacts or increased number of services. So it's both a breadth and a frequency look at engagement. And so, again, engagement intensity along these two axes, and no, we didn't see a dose response gradient. And I think there are a lot of interesting sort of takeaways from this. So the question here, the analytical question was, does more intense engagement predict greater reduction in child protection assessment? The answer to that question is no. The good news is that FRCs don't need time to ramp up. They start working for families in crisis right away. So that first visit, that cultural navigation, those service navigation, those things that happen when families first walk in the door seems to be really, really effective. Now, it can't rule out random chance and explaining other reasons that child protection fell, but it's, I think, another piece of the puzzle that's, I think, really compelling, although it might be counterintuitive. So again, the main benefit appears to be tied to initial FRC contact, not the more visits you go or the more numbers of services, the more protected you are. Do findings hold after accounting for who gets more services? So generalized propensity scoring. So this is a statistical adjustment that basically accounts for this idea that families who engage more with FRCs have greater needs. So we want to compare their outcomes to single visit families without adjusting for those differences. Like, that would be misleading. So the idea, maybe families with 10 contacts have harder problems than families with 1 contact. So what we did is we factored in for those measurable family differences from the data that we had, number of children in the household, whether or not they did have prior CP contact. Most of the variation in FRC engagement was really driven by things that we can't see. So we did not have a lot of detailed information that allowed us to predict what combination of demographic factors might tell us who is at risk for child protection. So yes, the flat dose response is real. There wasn't a hidden increase in child protection reduction associated with any of the family characteristics. So again, hammering the point home that the benefit is really in the connection, not in how frequently families visit family resource centers or in how many different kinds of services or in any combination of those things. Results, were they consistent across the program years? So we ran that same before-after comparison separately within each of the program years. This way, each family will serve as its own comparison point, so it's the same family before and after contact with family resource centers. And we found that the reduction was real in each of the individual years as well. So the pattern in child protection reduction holds. This gives us a lot of confidence that when we calculate avoided child protection assessments, that we are in fact calculating an effect that is really tightly associated with FRC engagement and contact. So in each of the years, fewer families had child protection involvement after FRC engagement compared to before. Lastly, how much do our results depend on our assumptions? And so we employed a difference in differences method by comparing Scott County with a neighboring county, Carver County, which in a lot of ways is demographically similar to Scott County. And so we took that same before and after lens that we looked at Scott County with, and we looked at Carver County. Carver County does not have family resource centers, but we can certainly look at trends in child protection assessment rates for that neighboring county to see, you know, are the declines in Scott County part of a broader secular trend, or is something special happening in Scott County? Here we can see the trajectory of child protection assessment rates per 1,000 families with children in each county. So in blue, we've got Scott County, and in red, we've got Carver County. They've got sort of a parallel trajectory before FRCs, and then after FRCs, a really, I think, steep decline. So the difference over this time period for Scott County was a 7.6 percentage point reduction. Over that same period of time, it was only a 0.7% reduction for Carver County overall. And so here, maybe I can.
And Justin, I might just throw in, I think Commissioner Beer, this is often a question, like, is this, like, what is this? How do we look at? And so I think this helps. This was at least compelling for us as we began to look at how do we position, how are we compared to a neighboring county that's pretty similar to us, when we know, like, not everything is exact, but our comparisons are similar.
So on this particular graph, like, because you're right, I always ask, and not just in this group, for, you know, a lot of times I just, well, what if we did nothing, you know, in different departments, programs, whatever, just kind of the control group of sorts. What would the numbers look like? So we're getting to some of that today. But now the new question is, not new, but that dotted vertical line, our numbers were dropping pre-FRC, and then at the implementation, they still are dropping, but they do tend to look to go down in that year out, because I'm sure we didn't implement, took a while to implement. Good times. But they were going down, so what's that about?
Well, COVID. I mean, I would say a combination maybe, but I think you also have to look at COVID. Kids weren't in school. We typically get most of our child protection reports from schools. We had less eyes on kids during those years, so I think all counties probably saw a decline during COVID.
And I think the other piece to think about is we started this sort of prevention conversations back in 2017, 2018 under board direction. So there had already, at the point Family Resource Centers launched, had community conversations around child abuse and neglect. We brought the data out to community to be talking about how do we influence this so that families do better and do have different. So yes, FRCs didn't launch them, but that prevention conversation emerged a couple of years prior, along with that impact of COVID.
Well, that's what I was,
We can discussions, right?
Correct,
Going
that
around.
launched in
Yeah,
2018.
Home visiting, I mean, I think it was even broader than just that,
Public health.
but yeah.
well, that's what I was gonna, so, yes, COVID, but wow, then COVID would look probably more like the red, but because of the things that were going on, potentially, that there, we weren't as, retreating from the public eye, or whatever the right word is. We were still engaged at different conversation levels so that that number, because I mean, the red, I would get that, okay, potential COVID thing. Blue one, so there was still some level of engagement, so there were eyes on, there were hands on, masks on, good times again. Interesting.
Well, the rate of decline on average doubled for
Right.
Scott County post
Yeah.
FRC implementation. And, that was, really clearly not the phenomenon for a neighboring county. So your question, what would have happened in Scott County without FRCs? This isn't a perfect answer, but I also sort of don't have the multiverse where I can stand up Scott County over these same years without FRCs and sort of do that comparison. So this is sort of the closest we can get. And again, layered with the other parts of this methodology, it gives us really great confidence in, sort of what we'll get to is how much are these reductions worth?
Right. Well, and that's where but moving forward, did I understand this, that Wilder will be the keeper of the kingdom, small k, on FRC statewide? So sooner than later, you'll start to be able to have whatever the other counties are.
As more organizations come on board, so to speak, because county and nonprofits are in different stages of development. So as they come on and they choose to, there's no mandate, because I want to be clear, this is the statewide work. It is not a state agency mandate. This is really county work that has evolved. And so as FRC step into the network, then yes, Wilder would be the holder of the data, which will help then with further program evaluation and research moving down the road.
Well, we'll really, influence others who are building these programs. I think when we looked around the country at how different family resource centers work and what they concentrate on, some much more basic needs than us, things like that, or I see some of our colleagues in other counties really doing a broader type outreach. And, looking at this data, I would say they're probably not gonna see as good of data with that broader outreach where we've stayed narrower to what this goal was, what are we trying to change?
Yeah.
So, yeah, I do think that this should be helpful to others, just they're a year or two behind us, most of them.
Big shout out to Carver County for providing this data.
They don't like looking
for
back.
this comparison. Well, Craig, I really appreciate the coordination that you did in that respect, and the idea that partnership with other counties as the network grows gives us an opportunity to apply this framework across other counties. So what we're doing here, we're hoping does serve as a model for a broader kind of evaluation of investments in family resource.
Right.
And it should be.
I would say that when Carver was here, we were having a totally different discussion on investments in child protection moving into 27 and 28 than Carver County was having, right? I think that reflects the difference in that discussion. Barb's probably hearing it at her level. I seriously hear it at the Metro County Administrator meeting. And so when this came back to you, why we were doing this is one of those three initiatives, right? The FRC, the Edna Galactus transformation homes. Do we continue to do them if they're showing those results? Versus like the treatment court, we invested, we found we transitioned our whole program. We don't need to continue doing that program.
Yep. It's good.
And sorry, I was just gonna say, it should be noted that Carver now does and has stood up at least one FRC, and so that this evaluation goes up to 25 to when they stood that up. So you can do that kind of pre and post now that Carver has it, but implementation and quite honestly, the depth of it is slightly different. They have one physical spot where there are 4 we know within Scott County too, and so some of that breadth too will be different if we come back and try to have a comparison 4 years down the road when Carver has been around for that length of time too. So like, it's never gonna be perfectly apples to apples, but we hopefully will be able to look at that. But that's if they voluntarily want to provide that data that we can look at, but we are so grateful for the fact that they did open up and say, hey, take a look, and here's what we know and see.
And this is as fair a comparison as we could construct.
Yeah.
You know, given the available data,
The
so.
demographics,
you know,
social, yeah, no.
And
I
I,
think
you know,
it's-
and I believe,
Great.
you know, I'll go to the next slide here, so we'll continue to unpack this. You can appreciate the magnitude of the difference between the differences. And so here you've got Carver County, Scott County before, after, and then the
Yeah.
comparison of that before, after. You can kind of see what the Scott County differential is. Now, you know, using this administrative data, looking at all of the other methods that we have, it would be very difficult to explain this kind of differential with something other than FRCs in terms of child protection reductions.
Suzanne, did you respond?
So, again, Carver County's decline in child protection, 0.7 percentage points. Scott County's 7.6 percentage points. All of this to say, it gives us really sort of great confidence that our results, when we get to the dollar signs here very, very soon, I promise, are sturdy. I wanted to make sure that I laid that groundwork before I put anything on the screen that had a dollar sign on it, because, all right, so we've got these 5 analytical layers. 4 out of the 5 sort of corroborate our findings, and that 4th does not contradict our findings, but actually adds another sort of piece to the implications, which is, you know, that initial contact with FRCs seems to be sort of a sweet spot. And, you know, the more that we understand about protective factors and how they persist over time, the better we'll be able to sort of fine tune this kind of research. So, what does an avoided child protection event save? It's a funnel, it's a cascade. And so if a family is assessed, there's a cost, child protection assessment cost. If a case develops, of course, they have to have been assessed first. And so what we do is we discount the cost of case management by the probability that they would have already been assessed, right? And so not all assessments turn into case management. We have to account for the probability that an assessment will turn into a case management, and on down the funnel, right? So a court proceeding, not all cases turn into court proceedings. For the ones that do, we want to discount the cost of a court proceeding by the probability that a preceding case management will have gotten there, and so on. So this is the cascading cost per avoided child protection assessment event.
I have a question. Earlier, you
Yes.
said 5% of the households prior came in with a CP event.
Yes.
Was it the assessment? Was it the case management? Was it the court proceedings? Or was it all the way through the out-of-home placement that 5% had gone through?
It's right at the top of right at the precipice of the cascade.
The assessment.
So,
It might have had
Some
more.
of them also had
Yes.
case management, out-of-home placement.
Mhm.
But that's part of how that probability was calculated, was looking at the likelihood that a case would progress through that funnel.
yeah, from looking at the cases that did progress through the tunnel. So that's how we sort of evaluated the probability that each of these stages would lead to the next stage, and make sure that that next stage isn't bearing the full cost of the prior stage, because it's not a certainty that every assessment will cascade all the way through. Thanks for that question, though. That's
Good question.
useful. Okay, so the social return on investment. Attribution, even if we only attribute 3 out of 4 of the avoided child protection cases that we calculated had occurred for FRC families, that would be 23 avoided child protection events. The total benefit would be $604,000. The net benefit after we subtract the average annual costs of FRCs is about $107,000. So the benefit to cost ratio, the social return on investment, again, very conservatively, is $1.21 for every dollar invested in FRCs. But again, this level of attribution is intentionally conservative. Excuse me, back here. If we adjust the attribution, right, we can talk about whether or not all 31 of the avoided child protection assessment cases that we calculated from that reduction of 5% to 2%, then, you know, this could go up as high as, I want to say it was $1.30, yeah, $1.35. So we're confident that it's in that range, right? Here requires us to dismiss all other possible causes for the reduction in child protection that we saw among FRC families, right? Now, analytically, we've already set aside as many of those as we could possibly do anyway, and we still want to try to give the families themselves some credit for that avoided child protection assessment. And so, you know, backing this off of 100%, you know, helps us to calibrate the, you know, how conservative we want to be with this result. The break even is around 2/3. So if only 2 out of 3 of the actual avoided child protection assessment cases that we observed for family resource centers were attributable strictly to family resource centers, then savings from child protection, from avoided child protection assessments alone pay for FRCs. And that doesn't include any of the things that FRCs do in terms of housing, in terms of food, in terms of employment. All of the other stabilization activities that provide value that could possibly be monetized in the future are not counted here. This is only avoided child protection system savings.
And I think the other piece, again, just as a reminder, because this was like hard for us to just grapple with, is this is about families who've had a child protection involvement, and do they come back into the child protection system? It does not account for families who have come in or have been touched by the Family Resource Center and never enter or never experience any child protection involvement. So it's just a much smaller pool, so to speak.
Well, in the scheme of things, that's what we are after here in Scott County. I know you kind of set the stage. These numbers were looking at that narrow focus of the child neglect. And from a county perspective, that's what we're after, is yes to minimizing these child protection engagements, and yes to not even getting in the front door.
Correct, right. Yeah, and what this is showing us is, at least when we look at the county dollar, our ROI is good. We're spending less than we would have of the county dollar. We have all these benefits that probably aren't the county dollar too, which as people we care about.
I think part of the story, at least from my view of it, is that writ large, Scott County great at keeping people from coming in the door before FRCs. FRCs came online and doubled down on whatever trend in reductions in child protection assessments had been occurring before. So, I mean, that only, if that's the harm reduction aspect of what FRCs do, imagine if we start counting all of the other sort of supportive services, stabilization services that are sort of beyond harm reduction, but maybe more into, you know, building on protective factors. And I think that that's also a fruitful place for future research is how do we think about how protective factors persist and mature over time? Do they atrophy? Do they compound? And what does that mean for how family resource centers interact and engage with families for that first visit, for that second visit, and so forth. So,
a question on,
yes,
Suzanne, this gets to something that we've talked about before is, so doing very, very rough math based on the numbers here, like the population going into the FRC has a higher prevalence of child protection cases just from the outset than the general population. We would also expect the population going into the FRC to have higher factors that would indicate a higher prevalence of it, like socioeconomic statuses, income, that sort of thing. Have we tracked any of that data to look at income levels or anything to say, hey, we would expect this population to actually be closer to 7 to 8% child protection involvement, 5% had it in pre, and we're down to 2% post or whatever?
We have not tracked.
Yep, we've not tracked income levels or socioeconomic.
I think as Commissioner Brecky and Leslie have referenced, like what are some next steps? I think looking at how do we engage families around some of those other data points would be a point moving forward. I think it's going to be, like if we look at socioeconomic status, there's now legislation with the act that child protection workers are going to have to collect that. How do we also then look at doing that from an FRC? Because I do think it over time, like it will tell us, right? Are FRCs having the impact as it relates to self-sufficiency moving forward? Not anything we've done so far.
Yeah. If I just extrapolate my thinking, it's almost like we're understating the impact because you'd expect this population to have a higher prevalence of child protection involvement.
Yeah, I think that's a really good way to say that. Like, I think this really shows, like, program dollar for program dollar, this fiscally makes sense. But you have all of the other factors that get involved in that are kind of the outside of that sphere. And that, I think, is where this really could be tapped in, and it really has some powerful potential for additional research later. But
and I think if Chris Harder was here, she would tell stories. And so because, right, she could look at FRC data and the SSIS data, like she can pick out the families that theoretically, you know, a homeless mom living in her car with 2 little kids. Like absent FRC, there is a huge likelihood that could have landed and probably would have, but we can't, right? We don't measure that because it never happened. But when you do sort of the qualitative look at the cases, I think you're right. Like we probably are underestimating the actual impact.
And it may be hard to ever fully capture that because this is a voluntary, you know, people are coming in on their own, and so we cannot tell them to please, you know, give us that data. We can't compel that, right? Yeah. And so we can try to put it out there, but will they report it accurately or at all? So you're right, this extrapolation, and that's why on this conservative side, this is very narrow and saying what we can absolutely prove and look at from the data. And I think we all as humans can look at that and say that there's maybe something else that might be there.
I did a number of things methodologically here in order to ensure that the results themselves were within a very sort of reasonable bound, right? There are, I'm sure, expectations in the county among families about, you know, whether or not engagement is something that can really serve to stabilize, and whether that stabilization, you know, is something that can persist. And you know, I'm encouraged by what we found in this data because, I mean, I'm a researcher. I don't have the same kind of proximity that Chris has. So we've got some fairly generic proxies for differences in demographic composition and whether or not there are types of families that are really driving the child protection reduction. I mean, and you can only tell from families that have some kind of child protection reduction at the outset. I mean, you know, I suppose you could preemptively take a Tums, but if you're not having, you know, stomach problems, then why just? So that's, you know, the takeaways here really, FRCs work. They do pay for themselves in just child protection system savings alone, and our estimates are the floor and not the ceiling. So lots more that can be done, lots more that is being done, and lots more that we're looking forward to supporting FRCs in this county in terms of, collecting some of that data and showing a fuller picture moving forward.
Yeah, and so I think as we think about how this coupled with what do we already know about some of our internal savings, right? Several years ago, we redirected 175,000, I think it was, from out-of-home placement. We are potentially looking at reductions in child protection staffing. And I think that is critically important because at a time when the vast majority, if not all, other counties are staffing up, we're talking about staffing down, so to speak. And so, and then when you look at it, again, for us, I think the most compelling, I'll say for me, was the comparison with Carver. Very similar county, and that rate of decline just substantially different. And so, like, as we think about just the overall outcomes as a layered versus, like, it's this in isolation, like, I think it's exciting opportunity in terms of where we're headed.
I think this was a good exercise in qualitative and quantitative research on things that we sort of thought were happening but don't completely know. And it feels like, yeah, we want to understate things, right? Because you don't know unequivocally. And I also think footnotes are important. Oh, we're not measuring this, and this, but believe and anecdotally know a lot of these things are happening. And I feel like this just helps. In the old days, you had those dashboards with a little altimeter up there, which we never paid attention to, and your temperature, but then you had speed and RPM. This maybe just kind of increased our dashboard on FRC, which is good, which is a good thing. But then I also think, is Wilder going to be the keeper of this information again, and sort of a driver, quasi-leader in FRCs, and then the next part of that would be, are we still thinking about going, and we have our Ps out there, whatever, where nonprofits would take this over, and then if so, do our governmenting numbers freak them out? Because we tend to probably, rightly or wrongly, this is not a, just is what it is, tend to be a little higher budget-wise than maybe a nonprofit would operate at, and so they see these numbers like, holy cow.
I think you're right, we're still in the RFP process, and I believe you'll be hearing Scott County Delivers in 2 weeks that will talk more about some of the internal data, and I think where we want to go, how can we execute what the vision was at the onset. Like, I can remember 5-6 years ago sitting before the board talking about the vision has always been this is better off position in community. It took maybe a little longer for a whole variety of reasons to get there, but we're executing that vision to move it, and we are hopeful that we have a pathway forward to that.
This got heartburn when you said 5 to 6 years ago, but I think that comes. I'll be back
and
in
I
business.
think in terms of whether we will have access to this similar data moving forward, I again want to thank Chris for all of her hard work putting this together. Not every county would be willing to or have the manpower to do what you did, and we're grateful for the investment that you made to give us this data. I think we would need to work really closely with other counties to find a way to try to replicate this in a less burdensome way, because Chris is phenomenal. And
SIS, just hit function F2 back. Smiley face upside down, and you should get nowhere.
And we're grateful that you gave us access to the county SSIS data. If we had waited for state level data, the lag is 18 months. We know that there would have been some significant things that would have happened between now and then. And so we were able to kind of shortcut to the analysis because we were able to access the data through you.
So Chris just found a consulting gig to other counties to.
I asked her for her ears were burning right now. We need to temper this discussion.
I just want to thank the information, because we've been asking, how do you prove, and we might not prove it, but at least we have more information to base our decision on. So thank you very much.
I have 2 questions, if I could, sorry, or 2 comments. One, I know this is a ways back, just on talked about Danny's question about child protection involvement rates for demographics, just that we weren't asking about income. But back to Commissioner Beer, I mean, we have some of those demographics, single family households. I think there's data out there about their incidence of child protection rates. So, I mean, we could use a higher number there, right?
I think the complication is we can't label a child protection family child protection family unless they're a child protection family.
Okay.
We all know what leads to that, right? It's your single family households, it's your
Yeah.
homelessness, it's your not having
Right.
basic needs, like it's all of those things. And I mean, I think for people that have worked at the Family Resource Center, you see a family come in, you see all of those things, and you know if they don't get their needs met, they're not going to end up in a good place. But we can't prove that until they end up in that place, which is what we're trying to avoid.
And from a social science perspective, prevention is one of the most difficult things to deal with, because you're sort of asking us to measure measure something that didn't happen in a world that we can't access.
Right.
So, you know, what would have happened to families without child protection assessment who never walked into FRC doors?
Yeah, we don't know. Okay.
But Justin did control for single family households
Okay.
in that difference analysis. So that was one of the factors.
Okay, that was in there. Thank you.
Yeah, the generalized propensity scoring is one of the techniques that, you know, actually controlled for this matching in terms of demographic profiles of families, so that this accounting for whether or not there is a high risk or low risk profile among FRC families was controlled.
Okay, good, thank you. Then my second thought, and this is just, I think it's important for us to, I mean, you've already alluded to it, and we should be able to state this, because I think it's clear that the act is costing us way less because of the FRC work and the work we've done over these years. And, you know, and again, you can put on all kinds of different hats about this, that we've said all the time, the intentions of the act are good and true and what we all want, 100%. It's just, we already were on that path. So I think that would be interesting if there were other counties who are somewhere close to where we are, and how much less in terms of percentages they have to add to their budgets this year to comply with the act.
The issue with the act is mandating the how and everything, and not giving staff the flexibility to make the individual decisions for the families, right, to come in. That's the frustrating.
Because other people didn't do it. You know, we were doing it. We should have got exempted.
And there are probably, there might be a couple other counties that are close or in line with us, but most of them, including Carver, was having a discussion on big increase.
100%.
Adding a number of staff, yes. Well, thank you certainly to our Wilder colleagues for their partnership and certainly being here with us today. And thank you to the board for, I think, walking through this. There'll be more FRC information shared here in a couple of weeks.
Great. Thank you for your time today.
Thank you.
Thank you.
All right, our next item is Rhonda's here to talk about site utilization for tax forfeited properties. So as you know, I get to be the acting CS Community Services Director right now, and brought up she'd like to bring forward an RBA to use a website to work through this process. And I said I thought we should have a little work session. She's here to present on that item. Rhonda?
Michelle, just a minute.
Tracy, yeah, you can be short.
Can I?
Yeah, I mean, we've looked at it.
When you say that, you don't know what that means to me. Give me 2 minutes, and we're done. Ask Michael. What I have to have what's first. Really, Rhonda? One sentence?
Oh, excuse me. Yes, 14.
What am I doing?
What is it?
Can you see the new teams meeting? No. Can you bring up your teams next
When you
week?
brought that question
Is that
up,
bigger?
what is that? Higher population, 14%.
Did you see,
Our Scott County population, single family household.
did you see how that compares to others? Are we in line, same,
No,
where's
I didn't
like?
compare it, I just looked
I'd
at
be
what is our
interested in
county
that.
single adult family household percentage, 14%.
When you saw it, what was your first?
Well, when you said,
And then
when you made
to
that
see it
comment,
correct
I was
was
thinking
better, so
we
that's
had like
good.
30, 40%.
Yeah, I was doing a little bit of research and I feel like there's an estimate, like sometimes it's up to a third, so
Yeah.
14 seems really low.
Oh, you're
know,
still
I mean,
sorry. I'll join the team.
But now,
But I
when
kinda
it's
believe
in
it.
context, it.
Yeah, I don't know if it's unusually low, I have to see it.
Yeah,
I didn't know Danny was doing her slide in and doing the new levy number.
14%. That's the next agenda.
You want us to wait for Leslie?
No,
Move on?
whenever
Okay.
you can go if you're ready.
Okay, basically, we're gonna be bringing to the board a RBA asking to do online options for our tax forfeiture process. As you all know, the Hennepin County case, the Hennepin County lost, so we got all new legislative processes to do tax forfeiture. And we're at the process now where we need to do a publication of when we're gonna do our EMV sale, and the EMV sale is your estimated market value, and you have to sell it for 30 days at that price. You have to put it out there. So it was either doing it in-house or doing it online. We felt online was a better resource because you can reach more people. We will have on our website where you can go out and click into that, so you can go out to this online auction. I have talked to other counties. Dakota does theirs in-house online, or in-house auction, so basically for 30 days, they have to have somebody available to answer anybody that comes in to talk about this auction. I did talk to Fillmore. They did it also too for in-house in 2024. They did it online last year for 30 days. They got better reception and they sold their properties doing it online. So I know Hennepin does it, but they have their own way of doing their stuff, so I'm not gonna talk in that. But, so just kind of I did show the online auction site that we are utilizing. We don't get charged. The person who does the bidding, they do have their,
Do we need to move a slide, or are we?
oh, I'm sorry, I was just talking.
That's okay.
So this is actually the process. So after we do the EMV sale for 30 days online, we have to do a minimum bid. The minimum bid is basically all your costs that you have put into this forfeiture. I am going to let you know that one of our parcels, which we have only 2 this year, the EMV is lower than the minimum bid because the EMV is less than what they owed. The other one, the minimum bid is less than the EMV. So that's just kind of how it can happen. And then for the minimum bid, we are not really sure how long because there is no I guess timeline. They did say for the EMV, you have to have it for sale for 30 days. So there is that timeline. But for the minimum bid, there was nothing that they stated. So I did reach out again. Dakota, they do a one and done sale for minimum bid. The day after the 30 days is up for the EMV, they do an in-person at their facility and they put it up for sale, and if it doesn't sell, then they put it, then we actually then have to go to, they called it the legacy, which is your traditional. So basically that's the one that started many, many years ago. So now we have to have it go to the county board, have it in either conservation, non-conservation. We have to get them, the sale price. So over-the-counter sale price. So that'll all be coming at the same time because we want to get it all done so that way we can just continue and not, because they only give you 6 months from the date it goes to the state to the date you have to do your EMV sale. So we only have a timeline of doing that. Because you do have to do the DNR for 30 days, then you have to give them a chance to repurchase for 60 days. So But just to let you know, the staff is amazing. This is the first year since I've been here that we've actually had forfeited properties.
Oh, wow.
Last year, we had 2 repurchases. They talked with them, worked with them, got them to repurchase it, so it didn't go forfeit and everything. So the process they start is this, well, right now, we're sending out letters to any taxpayers that, starting in 2027, will go tax forfeit, and we work with them to help them get to that point where they are not going to be in that process. 'Cause-
Right, that's our philosophy, right, Ron, to try to
Yeah.
prevent it.
Yep.
from
Right.
going-
So we're
And-
looking at 1 or 2 a year at most
Right.
that we would be using this process for.
Hopefully 0,
Yeah.
1 or 2 at most.
Yeah.
But, so, right now, I think we had 26. So hopefully by the first of the year, we'll be down to maybe 10. I think we started out at 82 last year in July, and by the time the first year came around, we only had 11. That would actually, we had to start the process.
Now, there's some, well, I can only think of one, it wasn't this county. Sometimes people have weird reasons for just letting something go to forfeit. Like, they may have their own reasons.
Yeah.
But
Well,
I think it's
the two-
important that we do try to do what we can, because we
The
don't want
two that
that.
we have are landlocked. Nobody can get to them. So the only ones that would actually be interested in them is the adjacent property owners. So that's usually the ones that go forfeit.
How did you choose the proposed platform, public service? Like, are there other options? Or
There
is this the
is.
one other counties are using that has the best reviews?
Well, to be honest, I was at a previous county, and this is the one that we were looking at, because I really liked how it was user-friendly. Very user-friendly, and again, talking to Fillmore, because I hadn't used it at that point, she says they walked it step by step. I mean, they are there for you, they are on the phone with you, so when you're setting up these options, they will actually help you get everything, and you have control of it. There is a state-run one, but the state has control over everything. This one, you have control. You can go in and change things, you can go in and do things, so.
Do
and
we pay the fee, or is there something where the buyer pays?
The buyer, they do have that in their
We don't.
things that it's a 5% on the sale.
So it's no cost to us, it should be a cost savings compared to if we had to run it.
Correct.
Yes, so if we aren't having that person constantly, they just go out and bid.
In the premium, again, going back to, doesn't these forfeiture lands go back to that lawsuit a
Yep.
few years ago?
Yeah.
And so if we're adding this buyer's premium, is that, looking at the attorney in the room, does that, oh, now you're profiting?
What he's
No,
asking
this
is.
is-
Oh, the 5%
The
is not
5%.
us.
No.
That goes to the county.
Correct, but
Right,
it's
yeah.
still an
But
add-on
it's
to the.
still allowed under the legislation.
Yes, because
Correct.
they offered it online. Legislation does give the counties the ability to do an online.
It's approved, and the state
I
has
figured
not
it was, I just
objected,
figured
it's
I'd
supported,
ask.
so.
Yeah, we just need you guys to approve that. You
Okay.
allow us to do this going forward.
That's what the resolution is about, that this is how we would move forward with an online auction versus coming into our office and those
Right.
things.
I
Yep.
think that makes perfect
Time
sense.
consuming.
Correct. We thought it made perfect sense too. Is there anything else you have, Rhonda, or is that?
It's just, that's kind of the, I mean, like I said, I gave you the link to look at the site.
Yep.
And I guess from the feedback from the other county that used this surplus site, they said even the customers liked how easy it was.
So the transfer of the deed and all that type of
We
thing, that
take care
still
of
is.
that, yeah. We don't do anything until we actually get the money.
Okay.
And that's even with any auction. We can't do that.
We still have to take care of that.
Yeah. And we'll have all those forms like online so that when they win the bid, we get them filled out. So, because we need all their information to be able to do in case we have to do an ECRB.
So can a bidder back out of a bid before they close?
Yes. I do know one of the counties did say they had that happen, but they didn't come up with the money.
Okay.
All right, anything else?
Unless you guys have any other questions?
Yeah, you know how to reach Rhonda, otherwise we'll bring it forward in an RBA.
Thank you. Consent?
Yeah, I was just going to consent.
Thank you.
All right, thank you.
All right, our next item is kind of a mix. Part of it's the 20-year budget history, but I want to introduce our intern, Joe, who's been with us for the summer now. And he has been digging into some of these big picture questions that you've been asking, and that this is a start, right? It's trying to show the relationship between the federal, the state, and the levy a little bit. What does it mean to be a HHS state that has the state kind of administering it, the county delivering the services, and I know I get those terms mixed up. And then the livability of Minnesota. And this is kind of a start. He's been working at it and digging into it. This is some really high-level census data that he has learned and worked with. And I'm hoping that this is something that we continue to evolve and move forward. I think there's even some state to state we need to look at maybe in the next couple weeks. But this was the last board meeting he was actually going to be working at. So we're bringing it maybe a week or a board meeting earlier, but I guess we have to give him a week's summer break off before he goes back to school. So anyway, with that, I'm going to turn it over to Joe, and Danny and Leslie and I don't know, Steve or whoever's here. We might hop in once in a while and help, but he's done a really, really nice job in trying to put this together. So
It looks like $1 million. Look at this guy. Huh? Come on.
I know, dresses for it and everything.
So to start out, we're going to go through public welfare, public health, and highway. And we're going to be looking at their payroll for county employees, and then their employees per 100,000 citizens, trying to get an even metric across states and different counties with different population sizes. It's important to note that for the census data, the last time it was available was 2022. They only do the data every 5 years for this specific case. And then we're going into that question, is these mandates making Minnesota less livable? So we'll be looking at income expenditures and taxes alongside that. So Minnesota ranks #1 in terms of public welfare, which means we spend the most per capita on public welfare, and we also have the most employees at the county level per 100,000. Scott County ranks 66 in terms of all Minnesota counties, and then 65th in terms of payroll. There were some problems, however, though, with the data collection. Most of the New England states, their data was scarce at best. Maine, Connecticut, I'll show it when we show all the states, which ones specifically. But New York and New Jersey, ones that we're going to use pretty prevalently, those data seem to be pretty good.
And are we pretty confident that Minnesota, I knew we were top, but numero uno?
It's pretty.
In terms of county spending.
Yeah.
So it's not the statewide, it's the county spending.
Yeah, you'll see here.
Okay.
And then employee data per 100,000. When we get down to the county level, I wanted to keep it steady at 100,000, but when we get down to the county level, it really exaggerates some of the data. Like when a county has a population of 3,000, their employee becomes in the thousands, which is nowhere near realistic, but it's just because of the mandates that they have on them, that it's a little bit higher for their population.
So it's the county spend on employees, though, not county spend on any other facets of the programs.
Yeah, so we're just looking at the employee payroll to try to get a gauge of this. It doesn't, like when we get into highway, we're not looking at their capital.
And it's people self-reporting that they work in a public welfare agency.
Yeah.
Okay.
And there was,
Looking at the social services side.
yeah, in terms of employee data, there's no differential between a full-time employee and versus part-time employee. They're all just added up as total employees in this case. Same with their payroll. So this is an example of all payroll per capita based on public welfare county workforce totals. These are all the HHS administered states. You can see that Minnesota tops the list at about $12.2 dollars per capita. California right behind us, under 12, and then a steep drop into Wisconsin, and then Virginia is at the rear of this list.
Okay, Ms. Nako, AMC. Your Highness, what, do we think these numbers would look any different? Because most of these, or many of these, are similarly administered.
So these are what we know from working with Barb and NACO, that are county-delivered, state-administered states, similar. Now, they might not be the exact same, remember, this is high level, Dave. That's why I said this is the
Yes,
start.
yes. And I'm just curious, like, because everyone's spending some level of money.
Well,
Right.
be patient.
Okay, all right.
Just
Right.
Let the next slide
Got
come.
it.
Yeah, because it'd be interesting to see this set with state, you know, because there's some states who are not here who have huge,
Yeah.
because they employ all those workers, like that's the.
Yeah.
Yeah.
Just as a means, all right. I'm part of the segue, that was my question to
The
ask.
next slide will be part of your segue.
And also, this data is 2022, so that's only
Sure.
2 years after
No.
COVID, so some of these numbers could be arbitrarily inflated. This is us compared to non-HHS states that were kind of in similar regions as the HHS states, trying to get a gauge of those regions, and you can see they're significantly lower than where Minnesota stands at the county level spending for these programs. If we look then at the national scale, all the states put together, we can see this trend further. States that are outside of the top 20 in payroll for counties don't even spend $1 onto public welfare. Here you can also see Connecticut, Maine, Rhode Island, Vermont, Massachusetts, and Delaware are states that we struggled with their data.
Yeah, some of them, yeah.
Again, this is
One of them doesn't
county.
even have counties.
Yeah.
so-
This is
County
counties.
spend.
Okay, so this,
Yeah,
like I
yeah.
said, moving forward,
Yeah.
we have to then look at the states, but there's
This
only
is
so much
count- this is-
time and
this
he had
is
other
count-
work.
No, this is great, this is awesome, but this graph is county spend only.
Correct.
Per capita.
Mhm. Then we look at counties around. We can see Traverse and Sibley County are higher because they're more rural counties, and then more of the metro counties as well. This is a common theme that the rural counties will be higher. It's also important to note that Travis County shares their public welfare with 2 other counties, which is part of the reason why their welfare is so high here.
So again, this, when they talk about the impacts of some of these mandates,
Oh,
you can see when you'll have a population of 3,000
Right,
people.
oh, man.
So that's why that one is so much higher than the metro, right? Because it's per 100,000. So you know darn well they don't have 40 employees.
And this
But
is
you
still,
have to keep it
yeah,
standard.
still
This is payroll.
and this is
Yep.
self-reported
Yep.
by workers who say they work in this
Yep.
field.
Yep.
Do we have any idea what that
It looks like it's,
variation is, or?
it looks like it's pretty accurate when you
Okay.
go and look at the county reports.
Okay,
The other thing is you're asking people and they're reporting the same way, right? It's the same question to the Census Bureau. So even if it's not accurate, like we went in and pulled their data,
Yep.
the reporting is gonna be the
Okay.
same, so it's a good comparison.
Right,
when you're looking at
right.
that.
We also wanted to look at employees to just see if like we're just paying a lot more versus having less amount of employees. And for Minnesota, it didn't look like this to be the case. The state's pretty level, at least in the public welfare sense. Continuing into the HHS county administered state, we can see Michigan rises here. They have more employees but pay cheaper. This is, in most cases this occurs, it's likely because of the part-time employers. I consider them as just full-time employees for the sake of these graphs. Same thing on the national scale, you can see some movement there, but not a lot. And then this, again, we can see the exaggeration. Traverse, or Travis County, has nowhere near 1,600 employees, but it's just they're a very, very small county. They share with other counties, so that's why it is so high. Onto public health, Minnesota ranks 14th in the number of employees per 100,000 and 9th in terms of payroll. Scott County is 60th in employees and 61st in payroll. There's only 62 counties available for this data. This is because it's divided up by regions.
And
There's just several groups who do it
Yeah,
together.
yeah.
And that was the same with the 65 in the
Right.
last one, there was like, we were whatever it was.
Yeah.
Okay. I didn't know there was a population, but got it.
So we are more in the middle of this list. North Carolina takes the top of this list, and then followed by California. In terms of non-HHS administered states, we jump up a spot, but we're still mainly in that middle mark. So there didn't seem to be that much of mandates in terms of public health that are affecting us here.
The other piece too is that like sometimes there are some social service programs where people rely more on their public health departments to administer them. So I will say like the Min Choices program for us in Minnesota, we tend to lean more heavily towards having our social services department administer that kind of entryway to access the waiver programs. Some might actually use their public health departments and rely on nursing staff to do that. So there could be like a more of a preference, like maybe in North Carolina for that to happen, or maybe in California for that to happen. So
I was just gonna confirm, I knew there was a state that eliminated county government altogether, and that is Massachusetts.
Gotcha.
And then it's Connecticut and Rhode Island that still have lines, but they don't do county government.
Gotcha.
Interesting.
So,
What's that here?
What? No, no.
Well, that's why Massachusetts
Right, but that's,
is zero.
it's not even, because they have no counties.
Correct, and so I think, again, it's high level, but I think the trend shows Minnesota overall tends to be one of the higher ones for cost per counties.
Yep.
Oh, yeah.
If you put the two of them together.
100%.
Mhm. And this is national scale, just to see the consistency. We're in the upper tier of the national scale. This is public payroll per capita, and you can see the counties that are more rural, they're gonna have higher costs. And then Carver, I found interesting, as they're more of a metro county like us, but they do have a higher payroll for these public health programs.
Is
And
that because they do more things in public health, Barb, that we do in human services, or?
I wasn't sure, right, when I
Okay.
saw this initially. I think we could do a little bit more asking around, but it definitely feels
Interesting.
not in line, so.
We're very low in public health compared to others.
Yes, in the per capita perspective.
Lisa just called. Hello?
And then per 100,000 for the HHS states, we can see we stay right in that same range relative. And then in the non-HHS states, relatively in the same range as those regions. But when we get to the national scale, we do fall back a little bit. Tennessee, Kentucky, they surpass us in this. It could just be the amount of part-time employees they have increased significantly. Utah now tops this list, and that is evident. They have tons of part-time employees that they count for public welfare, is a reason why this occurs.
So sometimes you're saying public welfare, sometimes
Oh,
public
sorry,
health?
public health.
So this one should be public health?
That's that change.
Okay,
Yep,
okay. And so employees are self-selecting public welfare or public health?
yes,
Oh, interesting.
Yeah.
Okay, so that probably gets cloudy too.
yes,
Right,
definitely.
Interesting.
Different states, and I think, Denny, you mentioned, in Kansas, they have food inspector workers that
That's
also.
where they do it, so like,
Yeah.
Kansas,
food
of course.
inspections happen all in the
Yeah.
state, or versus is it happening all in the?
Well, there's some that have a county here even, yeah, yeah.
But you know, it is interesting, because we took like ours, and we did it based on what we know about our employees versus what this, and we were within a couple of employees. So it is.
They are choosing correctly.
They are choosing correctly.
Yeah, no, and I think the health one's interesting because, yeah, it's so different what some states do in public health.
And we can dig into that and find that out. That's why I said this is a start,
Yeah, no.
there's more to come.
No, it's great to see, it's interesting to see, we can decide what we want to dig into.
Awesome.
And then, this is public health, at the county level, you can see, once again, the rural counties, they are, higher on this list. They're nowhere near the 200 that they're at, but because they're more rural and the mandates, we can see how that's affecting their, per 100,000 ability there. On to highway, we wanted to get, a distinction here to see if the funding towards these HHS programs are taking away from funding to different areas. So originally, we wanted to do both highway and transit, but there wasn't good enough transit data for most of the states, as they just don't classify it as transit. And so we left it with just highway. Minnesota ranks 13th in terms of employees and 6th in terms of payroll on highway. And Scott County ranks 83rd in employees and 82nd in terms of payroll. We are second on the HHS County Administered States with North Dakota topping the list. And this is similar with South Dakota, which we'll see in a second, where they are low population states with high geographical area.
And we decided, even though HHS administered had nothing to do, we kept the states the same, so you could just see how it worked out.
And you can see South Dakota is at the top of this list, same reasoning as North Dakota. And then on the national scale, same concept, Nebraska, Montana, these are all low population states with high geographical areas.
A neat graph that I think would be accessible to be able to kind of give more meaning to this would be to show the states versus percentage of roads that are county roads.
Yes.
You know, because that varies so much, and that would be interesting to see how that overlays.
You want the percent of roads in this, these are for county.
Right, I know, but like, there's some of these states that the percentage of all roads in that state, you know, is only 10% county roads, and other states where it's, so if we're talking about county workers and county workforce,
exactly.
That would be interesting.
So you want the percent of county roads by state?
No, of all roads that are county, county responsibility.
Yeah.
Okay.
There might be some that are 0.
But
There could be some that are 100%.
Yeah, like North Dakota, South Dakota.
a lot in Kansas, but a lot of like, you'd have this county road, and once the city annexed it, it was no longer a county road, it was a city road, and the county are mostly rural roads.
And then looking at the county perspective of this, Kitson and Cook County are at the top of this. Most of the counties that are at the top of this list are those ones that border in Canada. Again, keeping the theme of rural and high geographical area. Populations, in terms of employees per 100,000, we dropped 1 on this list. Wisconsin surpasses us here. Again, just being the makeup of the employees could be a factor along with Minnesota's pay.
I think the other thing is the 4 to the right are all very northern states with snow populations. So that impacts some of it as well. Some of your southern states can contract out because they don't need snow plowing. So they don't have to have as large of response maintenance systems.
And then we can see that same trend here. Northern states are still among the top of this list for the most part. And Kansas surpasses us here for the employees per 100,000. On the national scale, Iowa moves up to the top, and a few more states surpass us.
Before you move up highway, or I think you had one more, I just wanted you to go back and absorb that first slide where Scott County is 82 of 87 counties in our.
And
I'm
what's
just trying to
what's
absorb
the
that.
data, or what's the data point that we're at on?
Or we're
So
83rd.
it's per capita.
Yeah, so payroll per capita is at 83rd, employees per capita essentially is at 82nd.
So we are
Other
a
way.
fairly high population, small state.
Yeah.
My guess is you're gonna see Carver and Ramsey would probably be very close to us.
They are.
So that's why, right?
So you can see it here. It's the rural states, because they have, or the rural counties, they have larger geographical areas and their populations are lower, which is why we see them so much higher. They just have
The
more
metro areas are gonna
roads
be
that obtain.
lower here because of the density, our populations, and our mileages on what we serve.
But think of how the rural counties then are getting hit by mandates, and then they just already have a larger area to cover. So it's completely unsustainable.
Per capita county taxes, they're 4 times in the rural counties, but they're.
If you had it in our cities though, this would be going up high, and they wouldn't have that cost either.
They don't have the city cost, so the cities would look different again. Yeah. That's why the 6229.9 is so difficult.
So now we're going into income, expenditures, and taxes. All income and expenditure graphs, besides one which I'll point out, are going to be per capita. We have a federal tax rate that is shown. It is the highest federal tax rate, just kind of mirror what is happening. And then graphs that are not per capita are usually going to be in 100,000s. So if you have 45,000, it's actually 4.5 billion. And then for some graphs, it's important to look at the trends more than where the lines are at and seeing where we are going. And this is all to answer the question, is Minnesota livable?
Whose question? Whose question is that?
I don't know.
We had it all set for Commissioner Beer's
Yeah.
question.
Love it. That's a good question.
So for per capita expenditures by HHS states, we're trying to see, are these HHS states more expensive? There's tons and tons of factors that go into personal expenses of citizens, which we're looking at, but just kind of getting a general gauge. At the top of this list, we can see California and at about 67,000, and at the bottom of this, we can see Ohio at about 52,000, about 53,000, and I want you guys to keep in mind those top and bottom numbers. As we switch to the non-HHS states, they are a little bit cheaper.
So per capita expenditures, like per capita, what a person spends in a
Yeah,
year?
so like a
an
resident
average
spends in
person
the year.
Spends on life.
Yeah,
Okay,
yeah.
just checking what that meant.
And then for the non-HHS states, it's a little bit lower in the amount they're spending. In Washington, it's about 62,000 and 51,000 at the bottom of this list.
And Minnesota's in red, just to make it easier
Yeah.
to see that one, have it stand out. It's just not in there.
But the trends are all very, very similar.
Really?
What points do they hit, Joe?
Huh?
When you see the changes?
Yeah, so you can see the expenses, and we'll go into more of this in later graphs, but you can see expenses decrease significantly at 2 points, and one is the 2008 recession, and the other is during COVID, when people stopped spending during these times.
Super interesting.
This is the difference between Minnesota and then the United States per capita spending. And since 2003, we've been on a downward trend, and we no longer spend more than the United States average, which means we're putting less money into the economy, into the local economy, if we're spending less than the national average. Which,
Did the national average go up?
yes, so the national average goes up, and we'll see that in a second here. But for now, I want us to look at income. In Minnesota, per capita income over time for the past around 30 years has increased 2.9 times, or 290%. And comparing that with the United States average, the United States has increased 294%. So there's just slightly outpacing us, but that trend goes up and down, as we can see here, with relatively staying in around 2,000 range of Minnesota is making about $2,000 more than the national average. Here we can see the Minnesota income and United States income, and then also their counterparts in expenditures. You can see in 2018 is when the trend started to decrease for expenditures, and then COVID happened, and then the Minnesota's expenditures just never started to exceed the United States average there. It did surprise me, though, that Minnesota's income was still able to stay beyond the United States income, even though our expenditures are lower. This is the one graph we have that is not looking at per capita. The reasoning was to get a more flat look at how taxes affect people, and more specifically households. We can see in 2001 was the Economic Growth in Tax Relief Act that dropped the tax rate, and then it had a sunset period and came back in 2011, and then President Trump reenacted the same tax break in 2018 under the Tax Cuts and Jobs Act. You can see here, like we saw with expenditures, how in 2008 and 2020 are the biggest causes of whether people's income grows or decreases. It's not necessarily tax, but it's how the economy is doing at the time and how businesses are performing through it.
This is just federal income tax, and this is where you said you were using the highest rate for federal.
Yes, exactly. Yep.
It is interesting though, when you look at the Great Recession and you take a look at COVID and those impacts. And even the downturn in, what was it, 2001, 2002? But you look at that trend line overall, and it kind of catches back up with what he drew in there.
So this is Minnesota County levy across the entirety of the state. So all the counties collective, it gets to about a $4.5 billion total levy.
I don't feel like we talk about that enough, like how much we collect overall.
How much counts tax?
Yeah, like we haven't added it up before and like been like over at the Capitol saying, do you know what we have to spend to do this work?
This was a really the next couple of graphs are really interesting for that reason, but $4.5 billion.
I don't think I want to tell them, because then they're going to want levy limits.
Right, there's a double edge to that sword.
Yeah.
Well, I don't know that
spends
it's a
over a
double
billion,
edge,
right?
so it's the reality.
Yeah. And then here we can see total levy. This graph is a little confusing. We can see this right axis here. The top green line is the only one using the right axis. The rest of the graphs are going to be using that left axis. The green line is the total amount of levy across all different programs, so county, city, town, schools, specialty, and state. And then county and schools, we can see, are among the highest and kind of mirror the trend of how the total is affected. We can see counties increasing, decreasing along
So
the same
tax
trend.
levy, you're talking about property tax levy.
The
So
whole
when we
thing?
say state there, we're not talking about state
Is that-
income tax or anything like
Is that
that.
like
No,
145
state does
billion, or
have
what's
some
that number?
Right.
That is 14.5 billion.
14.5 billion.
Yes.
Look at the state, how they just manage, man, they are amazing.
They have other sources of revenue, this is our only one.
Right, they just have a minor levy involved there, but you look at the city's township schools.
Right, like 15 billion.
I think
So
we should
like-
say property tax.
Like
levy
health and
there.
human, so health and human services is like 40, almost 40% of the state budget. And school districts, K-12 is almost 40% of the state budget, right? So that's 80% together. And then, but yet they still have like all of this
Right.
piece here that they're not thinking about, which
They
They
don't
goes to
include in the
schools.
they don't
discussion.
think about the other $15 billion
Right, I mean, look
that
at
we're
the schools
levying.
there, yeah.
Yep,
It's not just us, so.
yep.
And the sharp decrease you're seeing in 2001, 2002 with the school districts is when states started to take the funding and try to help out schools, and then we can see how that slowly decreased into where they're at now.
Yeah, took it off local, tried to make it more state, and then
Yeah.
it's grown back.
Yep.
So next, it's trying to compare like we did with the tax rate in the U.S. with the U.S. federal tax rate, but looking at the Minnesota scale. So our Minnesota's income, expenditures, and then the levy, and trying to see if there's any correlation between a sharp increase in levy or not. The levy stayed pretty consistent throughout. So once again, it seems to be more of the economic health of the nation at the time dictating whether people's income is increasing or decreasing. This doesn't mean though if like the levy went up 50% for the next 5 years, like of course these graphs would start to go down. It just means it's more elastic.
So Minnesota income's going up faster than our tax levy.
Yes.
Which, we see that when we report our data.
Yeah.
The county, so.
Correct, you're gonna see that.
Seems to be a very livable state, Mr. Beer.
Needs to left the room.
He left, this is all for him, and he left the room.
So this is the Minnesota General and All Fund. The general fund is about 60% of all operating funds. That incorporates our income tax, corporate tax, sales tax, etc. As the all fund is our special revenues for like transit and healthcare. All fund also considers the intergovernmental revenue. So that is got revenue that is given from different government sources, mainly on average from different states. I couldn't find specifically for Minnesota, it's about 98% federal government. So you can largely think of the intergovernment fund as the federal government.
So this is the state?
Yes.
All funded, Minnesota all funded, Minnesota general fund?
Yes.
So not anything to do with?
Yeah.
Correct.
Thinking about our operating budget, and then we bring in the capital budget to create the full budget.
Yeah, so, maybe we should label it state.
And this was done at the end of the 2025 legislative session. So most of the 2025 data will be mostly correct, and then 2026, 2027, 2028 are all estimates at the time.
So you'll notice that they're estimating that they're gonna go down.
That's because they're shifting a lot of cost to us.
Which is what you're going to see in some of these graphs.
Yeah. And then trying to overlay that with the total amount of levy and the cost of levy to see if we were also increasing sharply or not. It's just hard to see these overall trends because the state or the general and all fund are just so much higher that it's harder to overlay and see the growth alongside of it. And there's so much more that encompasses all these funds, which is why it's also harder to see a trend there.
So they're upward, but because of the scale of the graph, it's harder to see that a little bit.
If you look at their, what about 35, 36 billion in their general fund. And we were talking about how much we had for the counties and the cities and everything, and yet we're still nowhere near that between, for the levies.
So this is Minnesota growth versus personal income over time. For the total owned revenue sources, those are all of the tax and non-tax incomes across the state, excluding intergovernmental revenue. And then it takes the Minnesota personal income, so that's the income of everybody in this room and like Anthony Edwards and your neighbors down the street, everyone in Minnesota, how much income they're making. And you divide those two numbers and you get this percentage. This percentage is used by economic people to decide how reliant they are on different government sources. And this trend shows that we were at 16% and we're dropping down to 14% over the last 30-some years, showing that we were becoming more reliant on federal funding versus self-sustaining state funding. It is important to note as well that the 2025 fiscal year through the 2029 fiscal year, those all have asterisks next to them to show that they are predictions from the time the data was taken.
So it says government is cheaper, a little bit, but also that they're more relying on federal funds than increasing state funds, correct?
Yes.
Potentially minor footnote to this, this brings me back to the old woodshed days, but this is monitoring a static grouping of funds, potentially. This isn't necessarily bringing new taxes or fees or...
This is showing the overall, so the overall amount that we're taxing in the state and the non-tax revenue, you add those together and then you exclude the intergovernment revenue. So it's basically,
Minnesota's cost to government.
yeah. It's all like the taxes, you're just excluding what the federal government or intergovernmental revenues are
So the
taking.
locals and the feds.
So what's the definition of total owned source revenues?
That's the taxes and the non-tax revenue added together.
So that's government revenue and Minnesota personal income. So personal income is going up. I'm just not understanding how we got to the conclusion.
Well, the personal income is going up, but so is the total owned source revenues, right? So then when you take and divide that number, that
Right.
gives you the other line.
But it's going down, like I
The
thought.
cost,
Yes.
the cost of government is going down.
Yes.
For the state of Minnesota,
Yeah.
not necessarily for the federal government.
So they're
which
using
has been
other
excluded.
sources to
They're
fund
using
it.
other people's money.
The decrease in the percentage is showing a
They're passing it through.
more reliance.
And you'll see some of it more highlighted in the program areas when you get into the
Thank
Health
you.
and Human Services 20-year budgets, but
So their programs are actually going up, state programs are going down.
I just don't understand how this shows that, but that's my problem.
As a
My
percentage of
intellectual
personal, it's as a
problem.
percentage of personal income, right? So.
Right.
Just like our budgets are going up, the percentage of levy that we're taxing our residents is going down as a
Right.
percentage of the personal income. And that's because we have state funds coming in, some less so, but the federal revenue that helps to offset it. And we've been kicking up the other way, not going down as much lately.
So would this capture, you know, I remember when Clinton was governor, wasn't he not the Bush, no new taxes, but there was all these fees. I'm not doing any taxes, but I'm doing I'm doing fees, you
Yeah, but
know.
that should be in total home source revenue.
Would that stuff be in there?
Yep.
So keep going, John, we'll show them.
So this is the intergovernmental revenue over time. Still the 2025 to 2029 is still estimates. You can see the large spike through COVID and how that funding has continued to come and how they predict it to continue.
So this is almost entirely federal revenue coming to the
to
state.
Minnesota.
Correct.
And how, based on where we're at today, how, with the projections,
Yeah, I'm surprised those projections are going up as much as they are when we're
Well,
looking
wait
at
a
so much
minute.
less.
They made these projections, remember, in 24,
Oh,
25.
okay,
So
okay.
that's why we're saying,
Okay.
we don't believe these are accurate
Right.
for 26, 27, and 28, especially 27 and
Yeah,
28.
thank you.
right, and you even get to a larger problem when you look at like the costs that are gonna be needed for our long-term services and supports, because we have things that are approved that look like this. And then you have the federal government who's chosen to maybe look at doing
Put money
penalties
into
for
other
SNAP and Medicaid. So then we're back to like what's statutorily in there and who's gonna fund the gap. And we might be looking at ourselves for that if something doesn't change.
that never happens.
But the point was, look at the increase in the federal government investment in the state of Minnesota and why we are concerned about moving forward when all we hear is cut, cut,
Right,
cut.
but that 27, 29 are not true there.
Correct, those are just projections by
Which
the
are-
state
as
of
noted,
Minnesota.
yep, as
This is
noted.
from OMB.
Yeah, in 25.
Yep.
And then this is the total amount of government revenue over the state. So this is the state government, the counties, the schools, every aspect of the state, and it's about $120 billion.
This one includes federal transfers to the state as well, right?
Yeah. I should say it's $120 billion at this time predicted for 2029.
So we are funding outcomes like crazy.
Yeah.
Unbelievable, the change and transformation that's happening out there with all that money. Wilder's gonna get back to us on
All
that
right,
one.
so here's now,
This is and then this is just a different look at it. This is it separated into different categories. You can see that non-tax revenues has stayed relatively consistent, while taxes has increased sharply after COVID, and then intergovernmental revenues has also increased.
but that intergovernmental revenue was huge, right? So you take a look at that federal spike post-COVID, all those one-time dollars they invested, and now it's one time, how do you maintain that?
So what are the impacts? County-run HHS programs increase both the average number of employees and average payroll in these states compared to their non-HHS counterparts, especially when we look at things like public welfare and public health. However, these do not take directly away from different programs like highways. Usually in these states, they just tax higher, which is why they're able to fund these programs differently at the county level. HHS mandates seem to affect rural counties more than they do urban counties. And then the total combined property tax levy in total state general fund expenditures should be considered when we're thinking about policies at the state and local level. And that is all I have for you guys on this presentation.
Keep going.
I hope that was fun.
This leads to more questions, we've decided.
Oh, yeah. Yeah.
Before Joe jumps into this, just some caveats on here. So this started with Leslie and Danny doing some stuff together, and we said, well, we need someone who's better at this than we are to actually pull it together and put a presentation on it. But we pulled the actual 20-year history for budget and levy as it was adopted by the board. And I say we, and Leslie did most of that over the weekend when her family was out of town. We also have 18 years of actual revenue history. So we have budget and levy, so that wasn't actual, but that was what the board adopted because that's the one static point in time. We can see it, you know it. And then it's the actual revenues for 18 years. So we're looking at slightly different things within here over that time frame. The other major thing to note within there is that there's no cost allocation included in these numbers. We took the actual direct service levy and direct service budget to include it. The reason we did that is because we haven't been doing cost allocation for 20 years. We've done that more recently. If we wanted to have apples to apples comparison about what's going on, it's not included in there in order to understand those trends. So keep that in mind as you're seeing some of these numbers in there. To put a little context though, and this is primarily focused on Health and Human Services. In 2007, so going back 20 years, in the what we consider the business center at the time, but HHS admin, finance, management group, there was a total of about $1.77 million. For 2026, the budget was $3.8 million. So that's about a 214.5% increase in that area that is not accounted for in those costs that we now allocate out within all of these departments, right? To put that in context as well, just so HHS doesn't feel like that increase, we also had OMB over that same time frame went up by 313% in terms of the funding there. Part of that, especially when you think about HHS, and this is why we put so much effort in that cost allocation, is you have increased mandates, you have increased reporting, you have increased review, all of these things that are part of doing these programs that are not included in those direct costs within there that come with that overhead. So I want to provide that context that there is a missing piece of that story that we've been trying to tell over the last 4 or 5 years to incorporate that, but it's not shown in these trends because it couldn't be included in there.
And part of OMB's increase, Danny, if I remember when you and I, it's technology. It's the system increases. It's the discussion we had earlier about 175,000 in year one and 2 million for the next 6 years, right? So it's those increases in OMB. It's not there were tons of people added, it's technology.
Major factor. Now on to the important part of the show.
Yeah. And these graphs are no longer in like 100,000s and that kind of thing. The numbers you see are just what they are. So for 2026, we can see where Scott County's total levy is just south of $80 million. Or sorry, $100 million of dollars, and how that has grown since 2007.
Just about doubled.
It's about $50 million. It's gone up in that 20-year history, a little over that.
The first program we're going to look at is fraud. You can see in 2007, we did not have much support from the state and federal government. And then as support has started to come, we've been able to lower our levy and decrease it and be able to keep it more level. Another thing I want to note is if you look at from about 2012 to 2018 or so, there's a lot of ups and downs with the graphs. This is just when the funding actually came to the county. So you can kind of try to picture those a little bit more flat throughout this if over a few years, if they're just really up and down like they are there.
And so remember, the revenue is actuals, so when the money actually came in the door for us. The budget and the levy are budget numbers, and they don't include cost allocation. So fraud wasn't actually making money because it doesn't include the cost allocation as part of that. That's why you see those numbers hit negative there.
The other thing that I think Joe hit on that is important, that I think somehow is part of our story that we all as a team have to figure out, when the feds and state engage and they're consistent with their funding, what are we? We're fairly consistent. We're delivering their program with minimal levy support.
Such a novel concept.
The next program we're gonna look at is public health. We can see how public health's trend has gone over time and how federal funding has now increased to help support the increase in budget.
So what has gone up, again, as the program's gone up, but kind of in line with the states and the feds through the mid-teens. The feds what? As you guys know, really spiked funding for public health out of COVID. So if that flattens and we continue to maintain, we're gonna have to see a levy increase moving forward.
Right, we also saw state grants increase in 2023 and 24, and we'll see what happens.
Can we go back to the first slide? And I know nobody wants to do that, but, so, we went from 50 million, what did you say we did 50 million?
About 44, yeah, 50 million.
Okay, and so then we're looking at about, but that's not quite
98 million.
Is that
About
about,
98 million.
so that's about 3.6, and then, but the growth in our county, are we gonna go through that too? I'm just getting at, because I'm getting at, remember we thought this growth and inflation,
Yep.
or whatever, would equal our levy.
Yeah,
How close?
We could, I don't think we charted that here, but we could chart that.
we do have the population, it's in a
Because
different series.
This is about 3.5%, and then if we went from 112 to whatever,
My
then
salary's
We were-
doubled in 20 years.
We were about 120,000 in 2009, and we're about 160,000 today, so 40.
that's 33%. Okay.
So we actually charted that, like Leslie was saying, we've kept it updated to show that our levy growth is not, it's right on pace, it almost matches exactly with the inflation plus growth, kind of
Yeah.
a little bit
I agree
different. We
with
have
that.
population and income growth.
Yep, we
that
have a
compare
graph.
it to.
It's not
That's
with
what
these
market
series, Commissioner, because this was showing federal and state. And we've talked about how do we show when they invest or disinvest, that that's what impacts the levy and consistency.
So now we have employment and training, and we can see how we've been able to keep the levy here relatively consistent till now, with federal and state mandates decreasing and funding likewise decreasing.
So
Yeah,
this
we
is,
kept a position on, in this area as some funding came off of the Drive for Five at the end of last budget, because we weren't sure what the work requirements were gonna do. We've had a retirement, we got new Drive for Five money, so that's gonna look different as we move into 2027. But overall, like, I will say, like, I've been around this work in particular for like 30 years, and there's just been less funding with it overall, and we have trended our budget down, like we've dropped staff over time with that, but it is something that I think we'll have to keep an eye on as we have more work mandates with some of our programs, but yet there's not funding to run work programs. Like, we just have to think about what and how we want to lean into that.
So Barb, in our discussion, if I remember this, as the mandates were less and the funding was less, we just kind of kept flat. If the mandates go up and they don't continue to fund it, we will see that blue spike then continue to have an issue.
Yeah, but potentially, and depending on however this shakes out, so, and.
I mean, and that's gonna be a little bit of a choice. I mean, work requirements, are we gonna try and help people get to work, or are we gonna say tough luck?
Yep.
So there is a choice there.
Yep.
That we'll be faced with. It's not a.
And we've been really fortunate, like when I first came here in 2013, we had several dislocated worker projects, like larger scale, like a Seagate locally that had major layoffs, and then we had additional funding. You can see that in like 2010, 2011, 2013, wanting to make sure that you're replacing those individuals at a similar wage. And we just haven't had a project, like, knock on wood, right? Like, we haven't had a large scale project like that, which is really what this programming is for. So I think we'll have some decisions on how to run this as we move forward.
Next slide we have is income maintenance in managed care.
managed care is a historical term.
Yes.
Sometimes Joe was pulling this together.
Yeah, and this is an example of something that we're looking for. The federal funding here is on cap, which means they cover a percentage of our expenses in relation to their mandates.
So this was like kind of what I was thinking of when there was that other graph that we had questions about in the previous slide deck that looked at kind of total expenditures. So if you look at that brown line and you look at the federal, like we typically get anywhere from 50% to 75% reimbursement of our actual cost. Like that is the model that we should be looking for. They need us to do some work. It should be the percentage of our actual cost that we should get reimbursed for. As you can see, the state is almost silent in how they help us. They gave us a little blip in 2023 when we had the MA unwind after COVID.
Yeah.
But then really after that, it's nothing. So when we're looking for funding models for health and human services, looking for an uncapped percentage of our actual cost. So we have a clear understanding of what they pay for, what we pay for, and what the state potentially pays for. And we don't have that negotiated agreement right now.
But the state pays very little.
Yep.
And the feds argue that their budget just does this.
Yep. Yep. So in the meantime, we fill the gap on a lot of this.
Because collectively, the conjoined budget does go like that.
What?
Right, with the state and when back
Well,
to the county.
the state's budget, like Barb said, they only put some money in to help with the federal, that unwind, right? They kept everybody covered while we were trying to get through the COVID era.
Yep.
And then they're back to, if you look at that line, it's pretty straight. They fund very little in
Right.
the state mandated program.
Right.
So this is WIC, and we can see large funding from the federal government has helped with the levy.
And you can see like there is no bar for the state here. So
What's that?
State
there's no
doesn't-
bar
it's
for the
not a
state.
program.
Yeah,
No,
it's
there's
not a
nothing
state.
for the
It's a
state
federal.
here.
Yeah, it's a federal program.
So in some cases, you're saying there isn't a blur between the state and the federal program. In some cases,
Well, yeah, I mean, the state,
as noted here.
right, the state is a pass-through essentially for
Right.
a federal requirement.
But in some other areas, the state doesn't always see that distinction.
Right, in some areas, they're really prescriptive on what we should do and still don't offer.
Right, I mean, that's why our human services systems are so complicated, because for 40 years, the state keeps adding little tweaks that no longer can we use an off-the-shelf system because of all the tweaks they put in. It's not our problem, federal program.
Home and community care, you can see the federal and state funding being relatively consistent with each other in the increase, and then in 2024, how the funding there has decreased and has caused the levy to increase.
So one thing I'd like to point out here is so you can look at the two like brownish lines in the middle from the federal and the state, they were almost on top of each other, right? And then in 2018, I think it was Senator Abler, like threw out that like the county should have a little bit of skin in the game. And so for the state share of min choices, so this are min choices assessments, they dropped it and added like a 15% like county pay on this. In the meantime, this is when we started to notice that we should be a standalone county. And so as we started having to shift people to min choices, we were getting no credit for it. And so we were being stuck with the whole reimbursement rate. So as our expenses like continued to go up, we got caught in not getting reimbursed in 2024 and 2025. And despite Leslie and I playing good cop, bad cop and trying to get mad at, they didn't give us any money back, but we are in a much better situation now for 2026.
We're seeing $1 million increase.
Right, yep.
So you go back that far, you're anywhere from $500,000 to $1 million probably that was county levy that went into those costs.
Now that said, I actually like if you ignore the standalone county piece at the end, if we could at least get the state to do uncapped, this is uncapped reimbursement again, this is what we would want this to look like minus what happened in 23, 24, and 25.
We had negative levy all those years.
We did. Well, okay, because if you add in your.
The allocations
yes,
and
yeah.
that.
There is not, remember, that's what I said.
Without the allocation.
So none of HHS management, finance, or administration is in here. That adds several $1 million depending what year we're talking about.
The other piece of this, and this goes back at least when I got here, when I went and talked to folks and said, why are we always negative in here? They said, well, you can't just really look at this piece. You also have to look at adult mental health at the same time because it's kind of one program that just got carved out in a certain way.
Well,
And so,
yeah, or developmental disabilities.
Yeah,
maybe
yeah,
that's what it
yeah.
is. Yeah, sorry.
Yeah.
Sorry.
And the other thing is there's some administrative costs we lost in here as well, Barb, along the way.
Yep. Yeah, so this
is a complicated one, but again,
It is.
it goes to the importance of the federal and state dollars.
It does. The next, well, I think the next one, right?
The next one is
Oh.
license, and we can see our levy is very high compared to where the budget is, and with very little federal and state help.
This is totally state mandated program with no state
Do
support.
we know what happened in 2013 to drive it up? They add another bucket on top of it? Or
Was
did
that
we
when
just,
Minlars was going on, or that was that?
or did we, this isn't that sort of
This is
license, this is
Daycare
child
and foster
care.
care.
Oh.
But, I mean, in the last 10 years, we've seen our licensed home childcare providers decrease by half. So again, I see this as an area where we have to do some work.
Yeah, yes,
This
agreed.
isn't-
And they've been frozen or positions have been changed to other areas, 2 of them.
Yeah, but I don't see that up there.
It's dropped in 26 some.
Yeah.
You'll
But
see,
again, for 50% less work over 10 years is what I'm talking about.
We have to get through 26.
you'll see the staffing drop again for 27.
Yeah. Takes time.
Next one is children's services. You can see at the start of this graph, there was not a lot of support, and then as more support came on, we were able to reduce our levy, support started to go away, and our levy starts to increase back up again.
Yeah, in 2015 is when, or 2016, they infused the child protection funding following the task force. But again, from a statewide perspective, that allocation has been flat. It was designed in statute to support staffing and services, but it has remained flat. Ours fluctuates, you know, like a few $1,000s here or there based on the formula, but statewide, it's just flat.
And again, the concerning thing is the federal is a big chunk of this. If they decide to pare back in any of these areas, it just gets slid through to the county.
But this is also the example of, as we reduce what's in child protection, so targeted case management, out-of-home placement 4E, which are sort of the federal dollars, as we shrink that, we will see the less federal revenue because we have less families essentially in that deep end.
And as I think we talked about, like the June, like we're looking at maybe reducing the number of FTEs in here by 2 for 2027. And in order to continue to maintain the upfront prevention work that we're seeing. So I don't know of another county that's doing that right now, so.
But the point again is the importance of the federal funding, and I don't know how to continue to push that discussion because every time the feds cut, the state slides it down. And I'm worried about what you're hearing out of DC.
Yeah, there's a lot of
More
cuts
coming.
coming this year yet. in the funds.
Community prevention response from 2001 to 2025. You can see the levy mirrors the budget with some help from the state and federal.
And the levy goes up here also between 22 to 23 because we took some out-of-home placement dollars in order to fund this. So we had out-of-home placement, which is all levy in the children's services budget that we just saw, and we moved it into this in order to fund that upfront prevention work. So.
And Barb and Suzette, this is the one you'd like to see the feds and the state slide their money into to help in that other area.
We'd really like to see formula changes, like really from a federal and state, they incentivize connection to the deep end of the system.
Yeah.
And so we lose revenue because we serve less, but we really ideally, based on research, we're getting better outcomes because we're helping families earlier, but we don't get the associated funding.
They're not willing to fund that.
Correct.
Developmental disability. There was a strong state funding at the start of this program, and it started to go away through the middle years, and we could see our levy increasing, and then when it came back, we were able to reduce our levy, and then it decreased again, and we're seeing that rise.
One other thing I would point out here in 22 and 23, you might all remember that our contract providers, we used to actually do all of the billing for that, and we used to keep an administrative portion because we're still the lead agency. And then in order to keep them, because the rates haven't changed, we had to give them everything, even though we're still the lead agency. And so you see our revenue drop because we weren't able to maintain that admin piece anymore, so then our levy had to go up because the work was still there, the clients were still there, the work was still there, just no payment
This
for
one
us.
probably shows a better, clear example of when the state doesn't fund its areas, the levy is picked up. When they do, the levy is able to drop back down. It seems actually pretty consistent in terms of the requirements of what we do. It's a lot of just about funding.
And that's, how do we tell that to
Yeah,
them? Right,
exactly.
to our reps?
Yep, and the
I
people.
think we've told our reps.
Yeah, I think this is one of those things where, which is, yeah, if you're not, life is so busy, I've said this before, but Jane and Joe, citizen, like, to grasp this and realize that, because we're the, sort of the front line of sorts. But the
They don't
reality
care
is, this is,
who pays for it, or they don't care which level of government does it.
well, not necessarily, but when it comes to time to voting, if we're aware of like why some of these things, I think that could change. And I think that's why St. Paul lives in that, not gray area, but like, people don't have short memories. Yeah, they're pissed off now, but
It's about their thing.
I gotta, gotta vote a party, I don't really agree, but it's like, so telling that story is important, not only for St. Paul, because I feel like they do know this and apparently don't
So
care
Barb,
or
this
whatever.
is one that irks me the most, because this is prescribed
Right,
system.
yes. Is this the
But-
30K one? Is this the one?
Yeah.
That's the, that spike is what, that's,
Yeah, so ignore the spike. We have to now receipt our school link mental health grant into the child welfare because it's social services and it's reporting to the state, and the CCBHC is separate than that. So we had to drop like a $700,000 grant in there and then increase the budget accordingly. So ignore that and just look at the federal and look at the state. If the state is like that zero line at the
30,000.
bottom,
Yeah.
So,
and again, this is totally mandated, caseload's mandated, system mandated. You couldn't even use a better mental health system if you had it. You have to follow that clunky system. So this is the classic.
It is a classic.
and this one might be prime for like a legislative, I push this session. So we met with the Metro last week to talk about like our youth work, and there's, I think, some interest in a children's mental health initiative fund, similar to our adult mental health initiative fund, which was created when all the state hospitals went away. And so we never had anything that was put in place for children. And so because of that, counties are having to step up and try to figure out that placement piece, and really some of the work for really some kids that are on the deep end or moving quickly towards the deep end of services. So that could help this. You agree?
Significantly.
Yeah, okay.
Okay, so, we always talk about, it was mentioned today in the other room, we have good problems to have, so to speak, living here in the metro. I can't help but imagine our cousins to the north, why some of them haven't already been bankrupted by state mandates and lack of pay, and so that makes me wonder, are they getting bailed out?
Higher. Well, no, they tax a lot
Okay,
higher
but,
than we
but
do.
what's the curve, I forget, I want to say left or right, that's right, what's the max?
Yeah.
We can tax, not we, what's the max governments can tax before the peasants start,
Right.
start an uprising? I mean, have those counties, some of those counties, and to the south too, but the one northern ones come to mind, just been bailed out
I
through,
mean, Beltrami has a couple
Yeah, they have
times.
been bailed out, yeah.
But again, you look at county tax rates and it's quadruple what we do in these smallest counties. Is this one that the other counties are getting in on? Because I feel like we keep talking about children's mental health and everybody's just like, eh. I mean, I don't hear much from our,
They don't look at these trends the way you pushed us to look at it. You hit a point faster of what's going on with federal and state money. Look at this, and it's caused us to go back and take a look at it. I think our neighbor to the east is starting to map some of these out with the issues they're having. We heard them come on corrections late, remember in 22 and 23 when we showed this same type of slide? And so I'm hoping they're taking a look at it and seeing those same types of trends. They must be.
Yeah, I think one of the things we talked about last week is that last session was such a, like there was water coming in the boat faster than we could like pull it out, right? Like we couldn't get our voice up above like all of the SNAP and Medicaid changes and MAPA. And so like even though there are still kids that are going to the emergency room and they can't get out, there's not a good spot for them and there's providers that are closing, like that just, it didn't get any airtime over all of the other problems that are there. And so I think like if we can create some space for that this session and be thoughtful about what things we need to bring forward, there's at least 7 County Metro interest in that.
Yeah. So the Children's Initiative Fund, we'd still have these same responsibilities and have to fund it. You're just saying it would create other providers and things that maybe would take kids out of these mandates? Is that, I'm just trying to connect the dots to what we keep talking about here.
I think potentially it creates that some of that upper stream, I won't say upstream, but earlier intervention points that may keep kids from that deeper end residential treatment programs, or even your higher price foster care, treatment foster care resources group waiver even, if we can actually use funding to support other kinds of intensive in-home. Like it's a gap, it's a gap in the metro period, and a CMHI may help fill that gap to prevent, again, the spin of the deeper end kids. Or how do we get kids out of JAF faster? Like there was a moment in time last year we were excited and proud about the fact we didn't have kids, and we've had, I mean, we don't have high numbers, but we have kids who stay a long time because there's simply nowhere else to go. And so how do we expand the service array? It may not impact
Well, yeah, that's what I'm
staffing.
just wondering. Everything we're talking about, I don't think it impacts this particular slide. Does it? Or
I mean,
how does it? I need to see that.
Yeah, I mean, I think it helps perhaps from a reimbursement standpoint,
Okay.
or for a payment, maybe it's an offset, or maybe it helps fund some of the prevention pieces that we talk about. I think we've made investments and have tried to move forward in children's mental health, schooling mental health, some of the child protection work, and we've done it without any support. And then you have other counties that haven't done it at all because there isn't support. So.
Yeah, and this isn't a small program, this is $1 million.
Yeah.
I mean, this is, when we talk about some of them, we're talking 100,000, right? And we're showing the same issue. This is a bigger program.
So the next program we have is Mental Health Center, and you can see how the county levy has been able, or in 2024 is when we became an HHCHB.
CCPHB.
That one. And that's why we're seeing the decrease in the levy in 2024 there.
Yeah, the overhead isn't in there, there's still some levy going to the mental health center.
But the allocation's in there, just not the human service overhead. Is that what we're talking about?
There's no cost
There's
allocation.
no
No
allocation.
cost.
Okay.
So the building, the computers, the
Yeah, okay.
systems. This is just the program cost.
And then this is community corrections, and you can see the levy on this is higher, and then state funding was able to help through 2021 through 2024 to relieve the higher budget costs.
But you see, like, we are working on some, but the expectations go right back up with what we're doing, having to have that additional reporting and everything else.
Right, that's
Some of
where we made
that's
that
a choice.
push.
We need to start making different choices.
And then this is the JAF. We can
What
see.
is that, hang on, so. what-
I mean, I think we have to really look at that. And I mean, if we look, every month we have less people in supervision, a couple less. Some of that is we're choosing to have a really good program, and we can choose to have a mediocre program. I mean,
So when we
I know
had,
we don't like to
but
talk
when
about
we
that,
had a
but-
mediocre program, our recidivism rates
Right.
were 17, 18, 19%. As we've reinvested in the program some, we're back at 15%. I'm hoping, right, our target is to be less than 10 by 28, 29.
I guess what I'm saying, I probably still would want that because I want the recidivism, but I'm willing to own that choice. That's what I'm saying. I'm willing to own that choice.
Right, but my concern is they still don't have a formula that helps the counties that are doing this and doing it the right way. Taking the fees away from us in why? If you choose to put $500,000 worth of fees and people can afford it, that should be your choice.
I agree.
Yep.
And I think again too, setting it up so that you've got the ability to have some sort of an uncapped reimbursement as well. The state does it, right? Like their programs, they're allowed to, they back the truck up to the general fund, and every time they increase their staff, they pay for it.
Yep.
And so we don't get the opportunity to do that, even though we're told to run these. So like having some sort of a formula.
This is the one program where I think you can overlay your KPI of the program and your investment in the program, and you actually show up and down of when it makes a difference. Children's mental health, I struggle with that one. I don't know what the outcomes are. I can't show you that these kids, you don't have the recidivism. We don't have 3 years later, they're doing better, or they're still struggling, or you know what I'm saying? This is one program where I think you've been able to overlay your KPI to your investment and seen a difference. I think your child protection with the FRC, you saw it today. You could see cost benefit of it. A couple of these, it's really hard, and somebody better come up with a way to show you that you're seeing those results.
Like, I hate to even say this, but it seems like with all of these slides, we're lamenting the state has the authority to mandate all these different things. We've seen, 40 different slides, different programs, whatever. Until, which is our laws, right? We have to follow, we must, and the money doesn't follow, so levies go, cost of government goes up. Until a couple, potentially larger counties teeter or toy with the idea of going bankrupt, nothing's gonna change. It'll be another faces in this room lamenting the same problems. Now I'm so passionate to push and fight, because I do think we do get some minor benefits over time, and hopefully more and more counties and states come online. Like, enough is enough, this is crazy. None of this is sustainable.
Is anybody pushing the governor candidates to talk about, when you do a fiscal note, it's the total cost to schools, to counties, when they do something? Is that even out there for a discussion? That's a huge part of this, right? But now's the time, I think Julie Ring is spot on to be pushing those questions, those discussions, and get it on record. Are any of them doing that? Because Commissioner Beer, what I'm worried about, these guys all have licenses, right? That are really important to their jobs and that they maintain for you. I think today that 4 items you saw in the audit that we had to go back and then look and check are because we don't have enough people covering some of those caseloads. And so we can say we don't want to cover programs, we don't want to do it, but then it's going to come back and you're going to be sitting there next August when Commissioner Brennan wants to see the audit. We went from 4 to 24. And that's how some of these things happen. And so it's easy for us to sit here and say, but we're mandated to do those, and I worry about those things in my chair.
No. And I think we're doing good work, and rather than say we don't want to do this, I would rather us we really should be igniting people to be lobbying. I mean, the state spends an awful lot of money on not these things. We should all be lobbying, no, there's no reason to spend money on that thing. I don't care if our levy stays here, if somebody else goes down, the total cost. That's some of what.
How does the state hire 500 people in DHS? 500 people.
Oh, I mean, I think we have that mentality.
We're struggling to support 3 or 4 to help with some of these programs.
I know, that's the rub. That's the rub, and it just feels like it's sort of been the same old rub for, I suppose, since.
It's been the whole graph, 20 years we're seeing it.
Yeah, and back the truck up.
And in some years, the point was, when they're stable and they're funding their mandated program, your levy is fairly stable, isn't it? But when it's not, look what happens.
And we all pay Minnesota income tax, federal income, so I'm not, it's not just a matter of like, whoa, let's just put it in a different bucket because it's all total tax, right? I think we do, I don't know the other counties as well, so I'm sure some do, but I do think that we, cute little adorable Scott County,
does have that mentality, some of our cities may disagree, but of like, what's the best way of administering government? Like I contend with better outcomes, I think you can have better outcomes at a lower cost, because the state's spending a ton of money on things that they aren't bringing benefit, because there's so much fraud going out the door, that shoot, have half of that back and we're having a totally different discussion.
I saw a news story the other day on the act in, I think it was Anoka County and another county were talking about the cost of the act. And then they interviewed Bobby Joe Champion and I was like, nope, they're wrong.
Yeah, I don't know where
He
they're
was
getting
like,
their numbers.
no,
He said,
and
I don't know where
then
they're
like-
getting their numbers. I don't believe it.
It was like, how can there be such a huge disconnect? Huge.
Right.
Well, I wonder if there's even a disconnect or if it's just diversion. I don't think there is a disconnect. I think they don't know.
Joe, do we have any more? Are we through?
We got a few more. I'm sorry. This is the JAF. We can see a decrease from 2020. This is when the per diems and the JAF increase, so that's why we're seeing a decrease in the levy there.
Great.
The chemical dependency is starting to be roped into the mental health center, so that's why we see a sharp decrease in all of the levy and budget.
But we're required to do that program as part of the CCBHC.
Right, it's part of the CCBHC now and
Yep.
insurance and.
There's still some pieces of it that are under the social service, I guess, kind of umbrella, like we have to pay for detox, and so we're kind of working that out, but there's some elements of it that we are able to get reimbursement for, and so I think that's a point, like on the mental health center one, we've added in some services, but it creates reimbursement in areas we didn't, so I think we're trying to figure out how to do that as best we can.
We're still working through it, but the overall direction has been a positive to the levy. So it takes time.
And probably better services.
More coordination, yeah.
And then this is the last one we have. This is another example of one that we want. Child support is, I think 60% of the cost here is taken by the federal government in this case, which helps us lower our levy and keep our levy more consistent.
And again, this one is based on true costs, right, Barb?
Right, 66% of the actual cost gets reimbursed, and so, again, the state is like non-existent there.
Amazing fiscal managers here.
So again, right, they just pass it through to the county.
And that is all I have for you. Thank you, guys.
That's it?
Thank you, commissioners.
Thank you.
Yeah, I'd like to thank Joe for all of his work. He comes in and he goes at it for 8 hours and he is inquisitive and asks questions and challenges us. So I want to thank him for his work this summer. We'll keep him busy the next week.
You only have 1 week left. I know you said that at the outset. I didn't remember.
Yeah.
Okay.
We have to give him his evaluation
Oh.
Thursday, so if you have any criticism.
Oh, man. Yeah.
Well, I just want to do a call out. I sent Joe an email late one day with some various funding, state and federal funding for child welfare, and provided not a whole lot of direction, and within an hour got just really helpful graphs and visuals back. So thank you.
Hey, I have one request. It's not homework. It's not a mandate. Just a request. You could leave it. Can be gone on a week anyway. I would love a paragraph or two, maybe 3, from you, the young lad, bright-eyed and bushy-tailed. Look at that, sharp dress too. On what is your takeaway as the next generation hanging around here the summer, hearing our whatevers here today and leading up to this, all of the input you've taken. And take it, do it or not. Not gonna grade you on that.
They'll do it.
Yeah, a couple paragraphs. So like, what is your takeaway from this as you see what you and your peers will be inheriting or have already inherited? And I would love your thoughts, and I would love for you to take that and run it through chat or something like that.
Okay. Will do.
Just out of curiosity to see this, right, next generation.
You don't have to do that if you
Yeah. Okay, I'll get it to you, yeah.
Thank you.
Thank you very much.
Yeah, thank you. Thank you, commissioners.
Round robin?
Yep, round one.
Nothing.
Everything,
I think, yeah, mine would just be, I think the flock thing is gonna be, conversation's gonna be brewing more with some of our cities, which would approximately mean us as well. Just to have, which I know we're having some conversation, not necessarily on flock, but law enforcement, public safety, dispatch, next generation stuff, and
I think that in data centers. Data centers.
So that's what I have. I want all of you to make sure you take a look at that corner. I want to thank Tracy and Ron Hobart. This is the commissioner's room. And so we have been putting, you've noticed pictures up, but you should go take a look at those plaques there. That is the history of Scott County Commissioners in Scott County starting in 1853.
wow.
And Tracy and Ron have just done a wonderful job on that, and you should be pretty proud of it. So thank you.
Is Joe on that first one on the left?
Did Alex
They're right there.
once make it between the